1. Understanding allergies in babies. 1.1 Common allergens in infancy. Babies are delicate beings, and their immune systems are still developing. As a result, they can be more susceptible to allergies than older children or adults. Allergies in infants can manifest in various ways, from mild skin irritations to severe respiratory distress. It is essential for parents and caregivers to be aware of the common allergens that can affect babies and take necessary precautions to prevent allergic reactions. 1.1.1 Food allergens. Food allergies are one of the most common types of allergies in infants. Certain foods can trigger an immune response in a baby's body, leading to symptoms such as hives, vomiting, diarrhea, or difficulty breathing. The most common food allergens in infancy include cow's milk. Cow's milk protein allergy is one of the most prevalent food allergies in babies. It occurs when a baby's immune system reacts to the proteins found in cow's milk, leading to digestive issues, skin rashes, or respiratory problems. Eggs. Egg allergies are also common in infants. The proteins in eggs can cause allergic reactions, ranging from mild to severe. Symptoms may include skin rashes, swelling, or gastrointestinal discomfort. Peanuts. Peanut allergies can be severe and life-threatening. Even a small amount of peanut protein can trigger an allergic reaction in some babies. Symptoms may include hives, swelling, difficulty breathing, or anaphylaxis. Tree nuts. Tree nuts, such as almonds, walnuts, or cashews, can also cause allergic reactions in infants. Like peanut allergies, tree nut allergies can be severe and require immediate medical attention. Soy. Soy allergies are relatively common in babies. Soy-based formulas or foods containing soy proteins can trigger allergic reactions, leading to symptoms like skin rashes, digestive issues, or respiratory problems. Wheat. Wheat allergies can cause symptoms such as skin rashes, digestive problems, or respiratory distress in infants. It is important to note that wheat allergies are different from gluten intolerance or celiac disease. Fish and shellfish. Fish and shellfish allergies are less common in infants but can still occur. Allergic reactions to fish or shellfish can range from mild to severe, and symptoms may include hives, swelling, or difficulty breathing. It is crucial for parents to be vigilant when introducing new foods to their babies. It is recommended to introduce one new food at a time and observe any signs of allergic reactions. If a baby shows symptoms of a food allergy, it is important to consult a pediatrician for proper diagnosis and guidance. 1.1.2 Environmental allergens. Apart from food allergens, infants can also be sensitive to various environmental allergens. These allergens are present in the air, dust, or substances that come into contact with the baby's skin. Common environmental allergens that can affect infants include pollen. Pollen from trees, grasses, or weeds can trigger allergic reactions in babies. Symptoms may include sneezing, runny nose, itchy eyes, or skin rashes. Dust mites. Dust mites are tiny insects that thrive in warm and humid environments. They can be found in bedding, carpets, or stuffed toys. Dust mite allergies can cause respiratory symptoms like coughing, wheezing, or nasal congestion. Pet dander. Pets, especially cats and dogs, can produce allergens that can trigger allergic reactions in infants. The proteins found in pet dander, saliva, or urine can cause symptoms like sneezing, itching, or respiratory distress. Mold. Mold spores can be found in damp areas such as bathrooms, basements, or kitchens. Inhalation of mold spores can lead to allergic reactions in babies, including respiratory symptoms or skin rashes. Insect bites and stings. Some babies may have allergic reactions to insect bites or stings. Mosquito bites, bee stings, or ant bites can cause localized swelling, redness, or itching. To minimize exposure to environmental allergens, parents can take certain precautions. Regularly cleaning and vacuuming the baby's living environment, using allergen-proof bedding covers, and keeping pets out of the baby's sleeping area can help reduce the risk of allergic reactions. 1.1.3 Other common allergens. In addition to food and environmental allergens, there are other substances that can trigger allergies in infants. These include medications. Certain medications, such as antibiotics or nonsteroidal anti-inflammatory drugs, NSAIDs, can cause allergic reactions in babies. It is important to be aware of any potential side effects or allergic reactions when administering medications to infants. Latex. Latex allergies can occur in infants who are exposed to latex-containing products, such as latex gloves or pacifiers. Symptoms may include skin rashes, itching, or respiratory problems. Skincare products. Some babies may be sensitive to certain ingredients in skincare products, such as lotions, soaps, or diaper creams. Allergic reactions to skincare products can manifest as skin rashes, redness, or irritation. It is crucial for parents to be observant and attentive to their baby's reactions to different substances. If a baby shows signs of an allergic reaction, it is important to seek medical advice to determine the cause and appropriate management. In conclusion, common allergens in infancy include food allergens, environmental allergens, and other substances such as medications, latex, or skincare products. Being aware of these allergens and taking necessary precautions can help prevent allergic reactions in babies. If parents suspect their baby has an allergy, it is important to consult a healthcare professional for proper diagnosis and guidance. 1.2 Signs and symptoms of allergies in babies. Allergies in babies can manifest in various ways, and it is important for parents to be able to recognize the signs and symptoms. While some allergies may be mild and easily manageable, others can be more severe and require immediate medical attention. Understanding the signs and symptoms of allergies in babies is crucial for early detection and appropriate intervention. 1.2.1 Common allergic reactions. Allergic reactions in babies can occur when their immune system overreacts to a particular substance, known as an allergen. The most common allergens that can trigger allergic reactions in babies include food allergens. Common food allergens in infants include cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. Environmental allergens. These include pollen, dust mites, pet dander, mold spores, and certain chemicals. Skin allergens. Irritants such as certain fabrics, soaps, lotions, and detergents can cause skin allergies in babies. Respiratory allergens. These include airborne allergens like pollen, dust, mold spores, and pet dander. Medication allergens. Certain medications, such as antibiotics or pain relievers, can trigger allergic reactions in some babies. 1.2.2 Symptoms of allergies in babies. The signs and symptoms of allergies in babies can vary depending on the type of allergen and the severity of the reaction. It is important to note that not all babies will experience the same symptoms, and the intensity of the symptoms can also differ from one baby to another. Here are some common signs and symptoms to look out for. Skin reactions. Babies with allergies may develop red, itchy, and inflamed skin. This can manifest as hives, eczema, or dermatitis. They may also experience dry, scaly patches on their skin. Respiratory symptoms. Allergies can affect the respiratory system, leading to symptoms such as sneezing, coughing, wheezing, nasal congestion, runny nose, and difficulty breathing. Gastrointestinal issues. Some babies may experience gastrointestinal symptoms like vomiting, diarrhea, abdominal pain, and colic. Swelling. Allergic reactions can cause swelling in various parts of the body, including the face, lips, tongue, and throat. This can be particularly dangerous if it affects the airways, leading to difficulty breathing. Eye irritation. Babies with allergies may have red, itchy, and watery eyes. They may also rub their eyes frequently. Behavioral changes. Allergies can make babies irritable, fussy, and restless. They may have trouble sleeping and experience a decrease in appetite. Anaphylaxis. In severe cases, babies may experience a life-threatening allergic reaction called anaphylaxis. This is characterized by a sudden drop in blood pressure, difficulty breathing, swelling of the throat, and loss of consciousness. Anaphylaxis requires immediate medical attention. 1.2.3 Delayed allergic reactions. It is important to note that some allergic reactions in babies may not occur immediately after exposure to an allergen. Delayed allergic reactions can occur hours or even days after exposure, making it challenging to identify the trigger. These delayed reactions can manifest as skin rashes, digestive issues, or respiratory symptoms. If you suspect that your baby may have a delayed allergic reaction, it is important to consult a healthcare professional for proper evaluation and diagnosis. 1.2.4 Differentiating allergies from other conditions. Recognizing the signs and symptoms of allergies in babies can be challenging, as they can overlap with other common childhood conditions. For example, symptoms such as nasal congestion, coughing, and sneezing can also be caused by a common cold or respiratory infection. Skin rashes can be a result of diaper rash or other skin conditions. It is essential to consult a healthcare professional for an accurate diagnosis and appropriate management. 1.2.5 Keeping a symptom diary. If you suspect that your baby may have allergies, it can be helpful to keep a symptom diary. Note down any symptoms your baby experiences, along with the potential triggers or allergens they were exposed to. This can assist healthcare professionals in identifying patterns and making an accurate diagnosis. In conclusion, recognizing the signs and symptoms of allergies in babies is crucial for early intervention and appropriate management. Common symptoms include skin reactions, respiratory symptoms, gastrointestinal issues, swelling, eye irritation, behavioral changes, and in severe cases, anaphylaxis. It is important to differentiate allergies from other conditions and consult a healthcare professional for an accurate diagnosis. Keeping a symptom diary can also aid in identifying potential triggers and patterns. 1.3 Diagnosing allergies in infants. Diagnosing allergies in infants can be a challenging task for parents and healthcare professionals. Since babies are unable to communicate their symptoms effectively, it requires careful observation and evaluation to determine if a baby is experiencing an allergic reaction. In this section, we will explore the various methods used to diagnose allergies in infants and provide guidance on when to seek medical help. 1.3.1 Recognizing allergic symptoms in infants. The first step in diagnosing allergies in infants is to recognize the common symptoms associated with allergic reactions. It is important to note that these symptoms can vary depending on the type of allergen and the baby's individual sensitivity. Some common allergic symptoms in infants include skin reactions. Allergic reactions can manifest as rashes, hives, or eczema on the baby's skin. These reactions may appear as red, itchy patches or raised bumps. Respiratory symptoms. Allergies can also affect the respiratory system, causing symptoms such as sneezing, coughing, wheezing, or difficulty breathing. These symptoms may be accompanied by a runny or stuffy nose. Gastrointestinal issues. Some babies may experience gastrointestinal symptoms like vomiting, diarrhea, or abdominal pain as a result of an allergic reaction. Swelling. Allergic reactions can cause swelling in various parts of the body, including the face, lips, tongue, or throat. This swelling, known as angioedema, can be potentially life-threatening and requires immediate medical attention. Behavioral changes. In some cases, allergic reactions can lead to irritability, fussiness, or changes in sleep patterns in infants. It is important to remember that these symptoms can also be caused by other factors, such as infections or irritants. Therefore, it is crucial to consult a healthcare professional for an accurate diagnosis. 1.3.2 Seeking medical help. If you suspect that your baby may have allergies, it is essential to seek medical help for a proper diagnosis. A healthcare professional, such as a pediatrician or allergist, will be able to evaluate your baby's symptoms and medical history to determine if allergies are the underlying cause. During the medical evaluation, the healthcare professional may ask you questions about your baby's symptoms, their frequency and duration, and any potential triggers or family history of allergies. This information will help in narrowing down the possible allergens and guide further diagnostic tests. 1.3.3 Allergy testing. Allergy testing is an important tool in diagnosing allergies in infants. However, it is important to note that allergy testing is not typically recommended for very young infants, especially those under 6 months of age, unless there is a strong suspicion of a severe allergy. There are two main types of allergy tests that can be conducted in infants. Skin prick test. This test involves placing a small amount of allergen extract on the baby's skin and then pricking or scratching the skin to allow the allergen to enter. If the baby is allergic to the specific allergen, a small raised bump or redness will appear at the test site. Blood test. A blood test, known as a specific IgE test, measures the levels of specific antibodies IgE in the baby's blood. Elevated levels of IgE antibodies to specific allergens indicate an allergic reaction. It is important to note that these tests may not be 100% accurate, especially in very young infants. False positives and false negatives can occur, and the results should always be interpreted in conjunction with the baby's symptoms and medical history. 1.3.4 Elimination diet and food challenges. In cases where food allergies are suspected, an elimination diet may be recommended. This involves removing the suspected allergen from the baby's diet for a period of time and then reintroducing it to observe any allergic reactions. This method can help identify specific food allergens that may be causing the baby's symptoms. Food challenges, under the supervision of a healthcare professional, may also be conducted to confirm the diagnosis. During a food challenge, small amounts of the suspected allergen are given to the baby, and any allergic reactions are closely monitored. 1.3.5 Keeping a symptom diary. Keeping a detailed symptom diary can be helpful in identifying patterns and potential triggers for allergic reactions in infants. Record any symptoms, their severity, duration, and any potential triggers such as specific foods, environmental factors, or medications. This information can assist healthcare professionals in making an accurate diagnosis and developing an appropriate treatment plan. 1.3.6 When to consult a healthcare professional. If you suspect that your baby may have allergies, it is important to consult a healthcare professional for an accurate diagnosis and appropriate management. Additionally, seek immediate medical attention if your baby experiences severe symptoms such as difficulty breathing, swelling, or a severe allergic reaction known as anaphylaxis. Remember, diagnosing allergies in infants can be complex, and it is crucial to work closely with healthcare professionals to ensure the well-being of your baby. 1.4 Preventing allergic reactions in babies. Preventing allergic reactions in babies is crucial for their health and well-being. As a parent, there are several steps you can take to minimize the risk of your baby developing allergies and to prevent allergic reactions if your baby already has known allergies. By being proactive and implementing preventive measures, you can create a safe and allergy-friendly environment for your little one. 1.4.1 Reducing exposure to allergens. One of the most effective ways to prevent allergic reactions in babies is to reduce their exposure to allergens. Allergens are substances that can trigger an allergic response in susceptible individuals. Common allergens include pollen, dust mites, pet dander, mold spores, certain foods, and insect bites. To minimize your baby's exposure to allergens, consider the following strategies. Keep the environment clean. Regularly clean your baby's living space, including their bedroom, play area, and any other areas they spend time in. Vacuum carpets, dust surfaces, and wash bedding frequently to remove allergens. Control humidity levels. Dust mites and mold thrive in humid environments. Use a dehumidifier or air conditioner to maintain optimal humidity levels in your home, ideally between 30% and 50%. Remove potential allergens. If your baby has known allergies, try to eliminate or reduce their exposure to common allergens. For example, if your baby is allergic to pet dander, it may be necessary to find a new home for your pet or keep them in a separate area of the house that your baby doesn't have access to. Use allergen-proof covers. Encase your baby's mattress, pillows, and bedding in allergen-proof covers to create a barrier against dust mites and other allergens. Keep windows closed. During high pollen seasons, keep windows closed to prevent pollen from entering your home. Use air purifiers with HEPA filters to help remove allergens from the air. Avoid smoking. Exposure to secondhand smoke can increase the risk of allergies and respiratory problems in babies. Keep your home smoke-free and avoid exposing your baby to cigarette smoke. 1.4.2 Introducing foods carefully. When it comes to preventing food allergies in babies, introducing solid foods carefully and gradually is essential. The American Academy of Pediatrics recommends exclusively breastfeeding for the first 6 months of life, as breast milk provides essential nutrients and helps protect against allergies. When it's time to introduce solid foods, follow these guidelines. Start with single-ingredient foods. Begin with simple, single-ingredient foods such as pureed fruits, vegetables, or rice cereal. Introduce one new food at a time, waiting a few days before introducing another, to monitor for any allergic reactions. Watch for signs of allergies. Pay close attention to your baby's reaction to new foods. Look for symptoms such as rash, hives, vomiting, diarrhea, or difficulty breathing. If you notice any signs of an allergic reaction, stop feeding that particular food and consult your pediatrician. Delay introducing high-risk allergens. Some foods are more likely to cause allergies than others. It is recommended to delay introducing high-risk allergens such as peanuts, tree nuts, fish, shellfish, eggs, and cow's milk until your baby is at least 1 year old. Discuss with your pediatrician when and how to introduce these foods based on your baby's individual risk factors. Gradually increase variety. As your baby tolerates different foods without any allergic reactions, gradually introduce a wider variety of foods to their diet. This will help them develop a diverse and balanced diet while minimizing the risk of developing allergies. 1.4.3 Maintaining a healthy lifestyle. A healthy lifestyle can play a significant role in preventing allergic reactions in babies. Here are some lifestyle factors to consider. Breastfeeding. Breastfeeding has been shown to help reduce the risk of allergies in babies. If possible, aim to breastfeed exclusively for the first 6 months and continue breastfeeding alongside solid foods for at least 1 year. Balanced diet. Ensure that your baby receives a balanced diet with a variety of fruits, vegetables, whole grains, and lean proteins. A well-nourished body is better equipped to handle potential allergens. Regular exercise. Encourage age-appropriate physical activity for your baby. Regular exercise can help strengthen their immune system and overall health. Adequate sleep. Make sure your baby gets enough sleep as it plays a vital role in maintaining a healthy immune system. Establish a consistent sleep routine and create a calm and comfortable sleep environment. Stress reduction. Minimize stress in your baby's life as much as possible. Stress can weaken the immune system and make your baby more susceptible to allergic reactions. Provide a nurturing and supportive environment to promote emotional well-being. 1.4.4 Consultation with healthcare professionals. It is essential to consult with healthcare professionals, such as pediatricians and allergists, to ensure you are taking the appropriate preventive measures for your baby's specific needs. They can provide personalized advice based on your baby's medical history, family history of allergies, and individual risk factors. By following these preventive measures, you can significantly reduce the risk of allergic reactions in your baby and create a safe and healthy environment for their growth and development. Remember to stay informed, be vigilant, and seek professional guidance when needed. 2. Food allergies in babies. 2.1 Introduction to food allergies. Food allergies are a common concern for parents, especially when it comes to their babies. Allergies occur when the immune system reacts to certain proteins found in food, mistakenly identifying them as harmful substances. This immune response triggers a range of symptoms, varying from mild to severe, and can even be life-threatening in some cases. Food allergies in babies can be particularly challenging as they are still developing their immune systems and may not be able to communicate their discomfort effectively. 2.1.1 Understanding food allergies in babies. Food allergies can develop at any age, including during infancy. It is estimated that around 5–8% of children under the age of 3 have food allergies. The most common food allergens in babies include cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. It is important to note that while these foods are common allergens, any food has the potential to cause an allergic reaction. 2.1.2 Causes of food allergies in babies. The exact cause of food allergies is still not fully understood. However, there are several factors that may contribute to the development of food allergies in babies. These include genetics. If one or both parents have allergies, their baby is more likely to develop allergies as well. The specific type of allergy may vary, but there is a genetic predisposition. Delayed introduction of allergenic foods. In the past, it was recommended to delay the introduction of allergenic foods to babies. However, recent research suggests that early introduction of certain allergenic foods, such as peanuts, may actually help reduce the risk of developing allergies. Immature immune system. Babies have developing immune systems, and their immune response to certain foods may be more sensitive or reactive compared to older children or adults. Leaky gut syndrome. Some studies suggest that a condition called leaky gut syndrome may contribute to the development of food allergies. This condition occurs when the lining of the intestines becomes more permeable, allowing food particles to enter the bloodstream and trigger an immune response. 2.1.3 Symptoms of food allergies in babies. Food allergy symptoms can vary widely from one baby to another. Some common symptoms of food allergies in babies include skin reactions. Babies may develop hives, eczema, or a rash after consuming an allergenic food. Digestive issues. Symptoms such as vomiting, diarrhea, abdominal pain, or blood in the stool may indicate a food allergy. Respiratory symptoms. Wheezing, coughing, or difficulty breathing can occur as a result of a food allergy. Swelling. Swelling of the lips, tongue, or face is a serious symptom that requires immediate medical attention. Anaphylaxis. In rare cases, a severe allergic reaction called anaphylaxis may occur. This is a medical emergency and can cause difficulty breathing, a drop in blood pressure, and loss of consciousness. 2.1.4 Diagnosing food allergies in babies. If you suspect that your baby has a food allergy, it is important to consult with a healthcare professional for a proper diagnosis. The healthcare provider will typically perform a combination of the following tests. Medical history. The healthcare provider will ask about your baby's symptoms, their frequency, and the timing of the reactions in relation to food consumption. Elimination diet. In some cases, the healthcare provider may recommend an elimination diet, where certain foods are temporarily removed from the baby's diet to see if the symptoms improve. This is usually done under the guidance of a healthcare professional to ensure that the baby receives adequate nutrition. Skin prick test. This test involves placing a small amount of the suspected allergen on the skin and then pricking or scratching the skin to allow the allergen to enter. If a raised bump or redness occurs at the site, it may indicate an allergic reaction. Blood tests. Blood tests, such as the specific IgE test, can measure the levels of antibodies produced in response to specific allergens. These tests can help identify potential food allergies. Oral food challenge. In some cases, the healthcare provider may recommend an oral food challenge, where the baby consumes a small amount of the suspected allergen under medical supervision. This is done to confirm or rule out a food allergy. 2.1.5 Managing food allergies in babies. Once a food allergy is diagnosed, it is crucial to manage your baby's diet to prevent allergic reactions. Here are some strategies for managing food allergies in babies. Avoidance. The most effective way to prevent allergic reactions is to avoid the allergenic food altogether. This includes reading food labels carefully, being aware of cross-contamination risks, and avoiding foods that may contain hidden allergens. Breastfeeding. If you are breastfeeding, it is important to eliminate the allergenic food from your diet as well, as some proteins can pass through breast milk and trigger a reaction in your baby. Formula selection. If your baby is formula-fed, your healthcare provider may recommend a hypoallergenic formula that does not contain the allergenic proteins. Introduction of solid foods. When introducing solid foods to your baby, it is important to do so one at a time, with a gap of a few days between each new food. This allows you to monitor for any allergic reactions and identify the specific food causing the reaction. Emergency action plan. Work with your healthcare provider to develop an emergency action plan in case of accidental exposure to the allergenic food. This may include carrying an epinephrine auto-injector and knowing how to use it. Educate caregivers. If your baby is in the care of others, such as daycare or a babysitter, make sure to educate them about your baby's food allergies, the signs of an allergic reaction, and how to respond in an emergency. Remember, managing food allergies in babies requires ongoing vigilance and communication with healthcare professionals. With proper management and support, most babies with food allergies can lead healthy and fulfilling lives. 2.2 Most common food allergens in infants. When it comes to food allergies in infants, there are several common allergens that parents should be aware of. These allergens have been found to be the most prevalent triggers of allergic reactions in babies. It is important for parents and caregivers to be knowledgeable about these allergens in order to prevent and manage allergic reactions effectively. 2.2.1 Cow's milk. Cow's milk is one of the most common food allergens in infants. It is estimated that around 2–3% of infants are allergic to cow's milk protein. The allergic reaction to cow's milk can range from mild to severe, with symptoms such as hives, vomiting, diarrhea, and in rare cases, anaphylaxis. It is important to note that cow's milk allergy is different from lactose intolerance, which is the inability to digest lactose, the sugar found in milk. 2.2.2 Eggs. Egg allergy is another common food allergy in infants. The proteins found in egg whites are usually the triggers for allergic reactions. Symptoms of egg allergy can include skin rashes, digestive issues, respiratory problems, and in severe cases, anaphylaxis. It is important to note that some infants may outgrow their egg allergy as they get older. 2.2.3 Peanuts. Peanut allergy is one of the most well-known and potentially severe food allergies in infants. It is estimated that around 1–2% of infants are allergic to peanuts. Allergic reactions to peanuts can range from mild symptoms such as hives and itching to more severe symptoms like difficulty breathing and anaphylaxis. It is important to note that peanut allergy is often a lifelong allergy, and strict avoidance of peanuts and peanut products is necessary. 2.2.4 Tree nuts. Tree nuts, such as almonds, cashews, and walnuts, are also common allergens in infants. Allergic reactions to tree nuts can be severe and even life-threatening. Symptoms can include hives, swelling, difficulty breathing, and anaphylaxis. It is important to note that tree nut allergies are often lifelong, and strict avoidance of tree nuts and tree nut products is necessary. 2.2.5 Soy. Soy allergy is another common food allergy in infants. Soy is a legume and is often used as an alternative to cow's milk in infant formulas. Allergic reactions to soy can range from mild symptoms such as hives and digestive issues to more severe symptoms like difficulty breathing and anaphylaxis. It is important for parents to read food labels carefully, as soy can be found in many processed foods. 2.2.6 Wheat. Wheat allergy is relatively common in infants, especially those who have started consuming solid foods. Allergic reactions to wheat can include skin rashes, digestive issues, and in rare cases, anaphylaxis. It is important for parents to be aware of wheat-containing foods and to read food labels carefully. 2.2.7 Fish and shellfish. Fish and shellfish allergies are less common in infants compared to other food allergens, but they can still occur. Allergic reactions to fish and shellfish can range from mild symptoms such as hives and itching to more severe symptoms like difficulty breathing and anaphylaxis. It is important for parents to be cautious when introducing fish and shellfish to their infants and to seek medical advice if there is a family history of seafood allergies. 2.2.8 Sesame. Sesame allergy is becoming increasingly recognized as a common food allergy in infants. Allergic reactions to sesame can range from mild symptoms such as hives and itching to more severe symptoms like difficulty breathing and anaphylaxis. Sesame can be found in a variety of foods, including bread, crackers, and salad dressings, so it is important for parents to read food labels carefully. 2.2.9 Other potential allergens. In addition to the common food allergens mentioned above, infants can also develop allergies to other foods such as corn, citrus fruits, tomatoes, and certain spices. It is important for parents to be vigilant and observant of any signs of allergic reactions when introducing new foods to their infants. It is important to note that food allergies can vary from person to person, and some infants may have allergies to multiple food allergens. If you suspect that your baby has a food allergy, it is important to consult with a healthcare professional for proper diagnosis and guidance on managing the allergy. 2.3 Identifying and managing food allergies in babies. Food allergies in babies can be a cause of concern for parents. It is important to identify and manage these allergies to ensure the health and well-being of your little one. In this section, we will discuss how to identify and manage food allergies in babies, providing you with the knowledge and tools to navigate this challenging aspect of parenting. 2.3.1 Signs and symptoms of food allergies in babies. Identifying food allergies in babies can be challenging, as they may not be able to communicate their discomfort effectively. However, there are certain signs and symptoms that can indicate a potential food allergy. It is important to be vigilant and observe your baby closely for any unusual reactions after feeding. Some common signs and symptoms of food allergies in babies include skin reactions. Look out for rashes, hives, or eczema that appear shortly after feeding. These reactions are often itchy and can be accompanied by redness and swelling. Gastrointestinal symptoms. Food allergies can cause digestive issues such as vomiting, diarrhea, or constipation. Your baby may also experience stomach pain or discomfort. Respiratory problems. Food allergies can sometimes trigger respiratory symptoms like wheezing, coughing, or difficulty breathing. These symptoms may be accompanied by a runny or stuffy nose. Swelling. In severe cases, food allergies can lead to swelling of the lips, tongue, or face. This is known as angioedema and can be a life-threatening condition requiring immediate medical attention. Colic-like symptoms. Some babies with food allergies may exhibit colic-like symptoms, such as excessive crying, irritability, or fussiness after feeding. If you notice any of these signs or symptoms in your baby, it is important to consult a healthcare professional for a proper diagnosis. 2.3.2 Common food allergens in babies. Certain foods are more likely to cause allergies in babies than others. It is important to be aware of these common food allergens and take necessary precautions when introducing them to your baby's diet. The most common food allergens in babies include cow's milk. Cow's milk protein allergy is one of the most common food allergies in infants. It is important to note that this is different from lactose intolerance, which is the inability to digest lactose, the sugar found in milk. Eggs. Egg allergies are also quite common in babies. Both the egg white and yolk can trigger an allergic reaction. Peanuts and tree nuts. Peanuts and tree nuts, such as almonds, walnuts, and cashews, are common allergens. It is important to note that peanut allergies can be severe and even life-threatening. Soy. Soy allergies are relatively common in babies. Soy is often used as an alternative to cow's milk in formulas, so it is important to be cautious when introducing soy-based products. Wheat. Wheat allergies can cause a range of symptoms in babies. It is important to note that wheat is often found in many processed foods, so reading labels carefully is essential. Fish and shellfish. Fish and shellfish allergies are less common in babies but can cause severe reactions. It is recommended to delay the introduction of fish and shellfish until later in infancy. 2.3.3 Introducing solid foods to allergic babies. When it comes to introducing solid foods to babies with food allergies, it is important to proceed with caution. Here are some guidelines to follow. Consult with a healthcare professional. Before introducing any solid foods, consult with your baby's pediatrician or an allergist. They can guide you on when and how to introduce potential allergens. Start with single-ingredient foods. Begin by introducing single-ingredient foods, such as pureed fruits or vegetables, one at a time. This will help you identify any potential allergies or intolerances. Wait a few days between new foods. After introducing a new food, wait for at least 3 to 5 days before introducing another. This will allow you to observe any delayed allergic reactions. Keep a food diary. Maintain a food diary to track your baby's reactions to different foods. Note any symptoms or changes in behavior after each feeding. Consider allergy testing. If your baby has a known food allergy or a family history of allergies, your healthcare professional may recommend allergy testing before introducing certain foods. Avoid cross-contamination. When preparing meals for your allergic baby, take precautions to avoid cross-contamination. Use separate utensils, cutting boards, and cooking surfaces to prevent allergen exposure. Read food labels. When purchasing packaged foods, carefully read the ingredient labels to ensure they do not contain any allergens your baby is sensitive to. Seek guidance from a dietitian. If your baby has multiple food allergies or requires a specialized diet, consider consulting a registered dietitian who specializes in pediatric nutrition. They can help you create a balanced meal plan that meets your baby's nutritional needs. Remember, every baby is different, and what works for one may not work for another. It is important to work closely with your healthcare professional to develop an individualized plan for managing your baby's food allergies. Managing food allergies in babies can be challenging, but with proper identification, cautious introduction of solid foods, and ongoing communication with healthcare professionals, you can help your baby navigate their allergies and ensure their health and well-being. 2.4 Introducing solid foods to allergic babies. Introducing solid foods to babies is an exciting milestone in their development. However, for parents of allergic babies, this process can be a bit more challenging. Allergies in babies can manifest in various ways, and certain foods can trigger allergic reactions. It is crucial for parents to be well informed and take necessary precautions when introducing solid foods to their allergic babies. 2.4.1 Understanding food allergies in babies. Food allergies occur when the immune system mistakenly identifies certain proteins in food as harmful substances. This triggers an immune response, leading to allergic reactions. In babies, common food allergens include cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. It is important to note that each baby may have different food allergies, and it is essential to identify and manage them accordingly. 2.4.2 Identifying allergic reactions to solid foods. When introducing solid foods to your baby, it is crucial to be vigilant for any signs of allergic reactions. These reactions can range from mild to severe and may include symptoms such as hives or rash, swelling of the lips, face, or tongue, vomiting or diarrhea, difficulty breathing or wheezing, runny or congested nose, coughing or sneezing, irritability or fussiness. If you notice any of these symptoms after introducing a new food, it is important to consult your pediatrician. They can help determine if it is an allergic reaction and guide you on the next steps. 2.4.3 Introducing solid foods to allergic babies. When introducing solid foods to allergic babies, it is recommended to follow a cautious approach. Here are some guidelines to consider. 2.4.3.1 Start with single-ingredient foods. Begin by introducing single-ingredient foods, one at a time, and wait for a few days before introducing another new food. This approach helps in identifying specific food allergies. Start with hypoallergenic foods such as rice cereal, pureed vegetables e.g., carrots, sweet potatoes, or fruits e.g., apples, pears. These foods are less likely to trigger allergic reactions. 2.4.3.2 Observe for allergic reactions. After introducing a new food, closely observe your baby for any signs of allergic reactions. If your baby shows any symptoms, stop feeding that particular food and consult your pediatrician. They can guide you on whether to reintroduce the food later or avoid it altogether. 2.4.3.3 Gradually introduce high-risk foods. Once your baby has successfully tolerated a variety of single-ingredient foods, you can gradually introduce high-risk allergenic foods. These may include eggs, peanuts, tree nuts, fish, and shellfish. It is recommended to introduce these foods one at a time, in small amounts, and observe for any allergic reactions. 2.4.3.4 Consult with an allergist. If your baby has known food allergies or a family history of allergies, it is advisable to consult with an allergist before introducing high-risk foods. An allergist can perform specific tests to determine the severity of the allergy and provide guidance on how to safely introduce these foods. 2.4.4 Precautions and tips for introducing solid foods. When introducing solid foods to allergic babies, there are additional precautions and tips to keep in mind. 2.4.4.1 Read food labels carefully. When purchasing baby food or any packaged food products, carefully read the ingredient labels to ensure they do not contain allergens that your baby is allergic to. Manufacturers are required to clearly list common allergens on their labels. 2.4.4.2 Prepare homemade baby food. Preparing homemade baby food allows you to have better control over the ingredients and minimize the risk of allergen exposure. Use fresh, organic ingredients and avoid adding any potential allergens. 2.4.4.3 Be mindful of cross-contamination. When preparing meals for your allergic baby, be cautious of cross-contamination. Clean utensils, cutting boards, and surfaces thoroughly to prevent any traces of allergens from contaminating the food. 2.4.4.4 Seek guidance from a registered dietitian. If you are unsure about which foods to introduce or how to ensure a balanced diet for your allergic baby, consider seeking guidance from a registered dietitian. They can provide personalized advice and help you create a safe and nutritious meal plan. 2.4.4.5 Stay prepared for emergencies. In case of accidental exposure to allergenic foods or a severe allergic reaction, it is crucial to be prepared. Keep emergency medication, such as an epinephrine auto-injector, prescribed by your pediatrician, readily available. Learn how to use it correctly and inform caregivers or family members about its location and usage. Conclusion. Introducing solid foods to allergic babies requires extra caution and careful observation. By following a step-by-step approach, starting with hypoallergenic foods, and gradually introducing high-risk allergenic foods, parents can help identify and manage their baby's food allergies. It is essential to consult with healthcare professionals, such as pediatricians and allergists, for guidance and support throughout this process. With proper precautions and awareness, parents can navigate the introduction of solid foods and provide their allergic babies with a safe and nutritious diet. 3. Environmental allergies in babies. 3.1 Types of environmental allergens. Environmental allergens are substances found in the environment that can trigger allergic reactions in babies. These allergens can be present both indoors and outdoors, and they can vary depending on the geographical location and the season. Understanding the different types of environmental allergens is crucial for parents to identify and manage their baby's allergies effectively. 3.1.1 Pollen. Pollen is one of the most common environmental allergens that can cause allergic reactions in babies. It is a fine powder produced by plants, including trees, grasses, and weeds, for the purpose of fertilization. When babies with pollen allergies come into contact with pollen, their immune system reacts by releasing histamines, which can lead to symptoms such as sneezing, runny nose, itchy eyes, and congestion. The types of pollen that commonly trigger allergies in babies vary depending on the region and the time of year. For example, tree pollen allergies are more common in the spring, while grass pollen allergies are prevalent in the summer. Weed pollen allergies, on the other hand, tend to occur in the late summer and fall. 3.1.2 Dust mites. Dust mites are tiny creatures that are commonly found in household dust, bedding, and upholstered furniture. These microscopic insects feed on dead skin cells and thrive in warm and humid environments. Dust mite allergies are prevalent in babies and can cause symptoms such as sneezing, coughing, wheezing, itchy skin, and nasal congestion. To reduce exposure to dust mites, parents can take several measures, such as using allergen-proof mattress and pillow covers, washing bedding regularly in hot water, and keeping humidity levels low in the home. 3.1.3 Mold. Mold is a type of fungus that grows in damp and humid environments, both indoors and outdoors. It reproduces by releasing spores into the air, which can trigger allergic reactions in babies with mold allergies. Common symptoms of mold allergies include sneezing, coughing, itchy eyes, and respiratory issues. Indoor mold can be found in areas with high moisture levels, such as bathrooms, kitchens, and basements. Outdoor mold can be present in damp areas, such as piles of leaves or soil. To prevent mold allergies, it is important to keep the home clean and dry, fix any water leaks or dampness issues, and ensure proper ventilation. 3.1.4 Pet dander. Pet dander refers to the tiny particles of skin, saliva, and urine that animals shed. These particles can become airborne and trigger allergic reactions in babies with pet allergies. Common symptoms of pet allergies include sneezing, runny nose, itchy eyes, and skin rashes. The most common pets that cause allergies in babies are cats and dogs. However, other animals such as rabbits, guinea pigs, and birds can also produce allergens. If a baby is allergic to pet dander, it is recommended to keep pets out of the baby's living area and to regularly clean and vacuum the home to reduce allergen exposure. 3.1.5 Insect allergens. Insect allergens can cause allergic reactions in babies when they come into contact with certain insects or their byproducts. Common insect allergens include the saliva, urine, and feces of insects such as cockroaches, mosquitoes, and dust mites. Allergic reactions to insect allergens can manifest as skin rashes, itching, swelling, and respiratory symptoms. To minimize exposure to insect allergens, it is important to keep the home clean and free of pests. This can be achieved by sealing cracks and crevices, using insect repellents, and maintaining proper hygiene practices. 3.1.6 Chemical irritants. Certain chemicals and irritants present in the environment can also trigger allergic reactions in babies. These can include household cleaning products, perfumes, air fresheners, and certain fabrics. Babies with chemical sensitivities may experience symptoms such as skin rashes, respiratory issues, and eye irritation. To reduce exposure to chemical irritants, parents can opt for fragrance-free and hypoallergenic products, avoid using strong cleaning agents, and ensure proper ventilation in the home. Understanding the different types of environmental allergens is essential for parents to create an allergy-friendly environment for their babies. By identifying and managing these allergens, parents can help alleviate their baby's allergy symptoms and improve their overall well-being. 3.2 Recognizing and treating environmental allergies in infants. Environmental allergies in infants can be a source of discomfort and concern for both parents and their little ones. These allergies are triggered by various substances present in the environment, such as pollen, dust mites, pet dander, mold spores, and certain chemicals. Recognizing the signs and symptoms of environmental allergies in infants is crucial for early intervention and effective treatment. In this section, we will explore how to identify and manage environmental allergies in babies. 3.2.1 Common signs and symptoms. Environmental allergies can manifest in different ways in infants. It is important to note that the symptoms may vary from child to child, and some babies may experience more severe reactions than others. Here are some common signs and symptoms to look out for. Nasal congestion and sneezing. Infants with environmental allergies may experience persistent nasal congestion and frequent sneezing. This is often accompanied by a clear, runny nose. Itchy and watery eyes. Allergic babies may rub their eyes frequently due to itching and irritation. Their eyes may appear red and watery. Skin rashes. Environmental allergies can cause skin reactions in infants, such as eczema or hives. These rashes may be itchy, red, and inflamed. Coughing and wheezing. Some allergic babies may develop a persistent cough or wheezing, especially if they have underlying respiratory conditions like asthma. Difficulty breathing. In severe cases, environmental allergies can lead to difficulty breathing or shortness of breath. This is a medical emergency and requires immediate attention. 3.2.2 Seeking medical evaluation. If you suspect that your baby may have environmental allergies, it is important to consult a healthcare professional for a proper diagnosis. They will evaluate your baby's symptoms, medical history, and conduct necessary tests to confirm the presence of allergies. Allergy testing, such as skin prick tests or blood tests, may be recommended to identify specific allergens triggering your baby's reactions. 3.2.3 Allergy management strategies. Once your baby has been diagnosed with environmental allergies, there are several strategies you can implement to manage their symptoms and provide relief. Here are some effective approaches. Avoidance of allergens. The first step in managing environmental allergies is to minimize your baby's exposure to the allergens causing their reactions. This may involve keeping windows closed during high pollen seasons, using allergen-proof bedding covers, and regularly cleaning and vacuuming your home to reduce dust mites and pet dander. Air filtration. Consider using high-efficiency particulate air (HEPA) filters in your baby's bedroom and other areas of the house to remove allergens from the air. This can help reduce the overall allergen load in their environment. Maintain optimal indoor humidity. Dust mites and mold thrive in humid environments. Use a dehumidifier or air conditioner to maintain indoor humidity levels below 50% to discourage the growth of these allergens. Regular bathing and cleaning. Bathing your baby regularly can help remove allergens from their skin and hair. Use mild, fragrance-free soaps and shampoos to avoid further irritation. Additionally, regularly clean their toys, bedding, and other items that may harbor allergens. Nasal saline rinses. Nasal saline rinses can help alleviate nasal congestion and remove allergens from your baby's nasal passages. Consult your healthcare provider for guidance on how to safely perform nasal rinses in infants. Medications. In some cases, healthcare professionals may recommend over-the-counter or prescription medications to manage your baby's environmental allergies. Antihistamines can help relieve symptoms like sneezing and itching, while nasal corticosteroids can reduce nasal inflammation. However, always consult with your healthcare provider before giving any medication to your baby. 3.2.4 When to seek emergency care. While most environmental allergies in infants can be managed with the strategies mentioned above, there are instances when immediate medical attention is necessary. Seek emergency care if your baby experiences severe difficulty breathing. If your baby is struggling to breathe, has rapid breathing, or shows signs of respiratory distress, call emergency services right away. Swelling or hives. If your baby develops sudden swelling of the face, lips, tongue, or throat, or if they develop widespread hives, seek immediate medical attention. Persistent vomiting or diarrhea. If your baby experiences persistent vomiting or diarrhea after exposure to a known allergen, it may indicate a severe allergic reaction and requires urgent medical evaluation. Remember, every baby is unique, and their response to environmental allergens may vary. It is essential to work closely with your healthcare provider to develop an individualized management plan for your allergic baby. With proper recognition, avoidance, and treatment, you can help your little one navigate their environmental allergies and provide them with the comfort they need to thrive. 3.3 Creating an allergy-friendly environment for babies. Creating a safe and allergy-friendly environment for your baby is crucial in preventing allergic reactions and ensuring their overall well-being. By taking certain precautions and making some adjustments to your home, you can significantly reduce the risk of allergens triggering allergies in your little one. In this section, we will discuss various steps you can take to create an allergy-friendly environment for your baby. 3.3.1 Minimizing dust and dust mites. Dust and dust mites are common allergens that can cause respiratory allergies in babies. To minimize their presence in your home, follow these tips. Regularly vacuum and dust your home using a vacuum cleaner with a HEPA filter. This will help remove dust and allergens from carpets, rugs, and furniture. Use allergen-proof covers for your baby's mattress, pillows, and bedding to prevent dust mites from accumulating. Wash your baby's bedding, including sheets, blankets, and stuffed toys, in hot water at least once a week to kill dust mites. Keep stuffed animals to a minimum, as they can harbor dust mites. If your baby has a favorite stuffed toy, make sure to wash it regularly. 3.3.2 Controlling pet allergens. If you have pets at home, their dander can trigger allergies in some babies. Here are some steps you can take to minimize pet allergens. Keep pets out of your baby's bedroom and play areas to reduce exposure to pet dander. Regularly groom your pets and bathe them to reduce the amount of dander they shed. Vacuum and clean your home frequently, paying special attention to areas where your pets spend the most time. Consider using air purifiers with HEPA filters to help remove pet allergens from the air. 3.3.3 Maintaining clean indoor air. Indoor air quality plays a significant role in preventing respiratory allergies in babies. Here are some ways to maintain clean indoor air. Avoid smoking inside the house, as secondhand smoke can worsen respiratory allergies and increase the risk of asthma in babies. Use natural cleaning products or those labeled as hypoallergenic to minimize exposure to harsh chemicals. Keep the humidity levels in your home between 30% and 50% to prevent the growth of mold and dust mites. Use a dehumidifier if necessary. Open windows regularly to allow fresh air to circulate and reduce the concentration of indoor allergens. 3.3.4 Eliminating mold and mildew. Mold and mildew are common allergens that can thrive in damp areas of your home. To prevent their growth and minimize exposure to your baby, follow these steps. Fix any leaks or water damage in your home promptly to prevent the growth of mold and mildew. Use exhaust fans in bathrooms and kitchens to reduce moisture levels. Clean and dry any areas prone to moisture, such as shower curtains, bath toys, and bathroom tiles. Regularly inspect and clean areas where mold and mildew are likely to grow, such as basements, crawl spaces, and attics. 3.3.5 Reducing allergens in the nursery. The nursery is where your baby spends a significant amount of time, so it's essential to make it as allergen-free as possible. Consider the following tips. Choose hypoallergenic bedding, including mattresses, pillows, and blankets, to minimize exposure to allergens. Avoid using carpets in the nursery, as they can harbor dust mites and other allergens. Opt for hardwood or laminate flooring instead. Keep the nursery clean and well ventilated. Regularly dust and vacuum the room to remove allergens. Avoid using scented candles, air fresheners, or other fragrances in the nursery, as they can trigger allergies in some babies. 3.3.6 Maintaining a healthy diet. While not directly related to the environment, maintaining a healthy diet for your baby can help strengthen their immune system and reduce the risk of allergies. Here are some dietary tips. If you are breastfeeding, try to eat a varied and balanced diet that includes a wide range of foods. This can help expose your baby to different flavors and potentially reduce the risk of developing allergies. If your baby is formula-fed, consult with your pediatrician about hypoallergenic formulas suitable for babies with allergies. Introduce solid foods gradually and one at a time, observing any allergic reactions. This will help you identify and manage any food allergies your baby may have. By implementing these strategies and creating an allergy-friendly environment for your baby, you can significantly reduce the risk of allergic reactions and provide them with a safe and healthy living space. Remember to consult with your pediatrician if you have any concerns or questions regarding your baby's allergies or environmental modifications. 3.4 Dealing with seasonal allergies in babies. Seasonal allergies, also known as hay fever or allergic rhinitis, can affect people of all ages, including babies. These allergies occur when the immune system overreacts to certain substances in the environment, such as pollen, mold spores, or dust mites. While seasonal allergies are more common in older children and adults, babies can also experience symptoms that can be distressing for both the child and their parents. In this section, we will discuss how to identify and manage seasonal allergies in babies, as well as provide tips for creating an allergy-friendly environment. 3.4.1 Identifying seasonal allergies in babies. Identifying seasonal allergies in babies can be challenging, as they may not be able to communicate their symptoms effectively. However, there are some signs that parents can look out for. Persistent sneezing. If your baby is constantly sneezing, especially during specific times of the year, it could be a sign of seasonal allergies. Runny or stuffy nose. Babies with seasonal allergies may have a runny or stuffy nose, which can make it difficult for them to breathe properly. Watery or itchy eyes. Irritated and watery eyes are common symptoms of seasonal allergies in babies. They may also rub their eyes frequently due to itching. Coughing and wheezing. Some babies with seasonal allergies may develop a cough or wheezing, similar to symptoms of a cold or respiratory infection. Skin irritation. In some cases, seasonal allergies can cause skin irritation in babies, such as redness, rashes, or eczema flare-ups. If you notice any of these symptoms in your baby, especially during specific seasons, it is important to consult with your pediatrician for a proper diagnosis. 3.4.2 Managing seasonal allergies in babies. While there is no cure for seasonal allergies, there are several strategies that can help manage your baby's symptoms and provide relief. Limit exposure. Try to limit your baby's exposure to allergens by keeping them indoors during peak pollen times, such as early morning or late afternoon. Keep windows closed and use air purifiers with HEPA filters to reduce indoor allergens. Keep the environment clean. Regularly clean your baby's room and other living areas to minimize dust, pollen, and other allergens. Vacuum carpets and rugs frequently, and wash bedding and stuffed toys in hot water to remove allergens. Use saline nasal drops. Saline nasal drops can help relieve nasal congestion and clear out allergens from your baby's nose. Use a bulb syringe or a nasal aspirator to gently remove mucus if necessary. Avoid irritants. Avoid exposing your baby to irritants such as cigarette smoke, strong perfumes, and harsh cleaning products, as these can worsen allergy symptoms. Consult with a pediatrician. If your baby's symptoms are severe or persistent, it is important to consult with a pediatrician. They may recommend over-the-counter antihistamines or prescribe medication to alleviate symptoms. Consider allergy testing. In some cases, your pediatrician may recommend allergy testing to identify specific allergens that trigger your baby's symptoms. This can help you better manage their allergies and avoid exposure to those allergens. 3.4.3 Creating an allergy-friendly environment for babies. Creating an allergy-friendly environment for your baby can help reduce their exposure to allergens and minimize the severity of their symptoms. Here are some tips to consider. Keep indoor air clean. Use high-efficiency air filters in your home's HVAC system to trap allergens. Regularly clean air vents and change filters as recommended. Remove shoes at the door. Encourage family members and visitors to remove their shoes at the door to prevent tracking in pollen and other outdoor allergens. Wash hands frequently. Encourage everyone in the household to wash their hands frequently, especially after being outdoors, to remove allergens from their skin. Avoid outdoor play during high pollen counts. Check local pollen forecasts and try to limit outdoor playtime when pollen counts are high. Keep pets clean. If you have pets, make sure to bathe them regularly to reduce the amount of allergens they carry. Avoid hanging laundry outdoors. Pollen can easily stick to clothes and bedding when hung outdoors to dry. Use a dryer instead to minimize exposure to outdoor allergens. By implementing these measures, you can create a safer and more comfortable environment for your baby, reducing the impact of seasonal allergies on their daily life. Remember, every baby is unique, and what works for one may not work for another. It is essential to work closely with your pediatrician to develop a personalized plan to manage your baby's seasonal allergies effectively. With proper care and management, you can help your baby navigate through the challenges of seasonal allergies and ensure their well-being. 4. Skin allergies in babies. 4.1 Common skin allergies in infants. Skin allergies are a common concern among infants, causing discomfort and distress for both the baby and their parents. Understanding the different types of skin allergies that can affect babies is crucial in order to identify and manage them effectively. In this section, we will explore the most common skin allergies in infants and provide guidance on how to address them. 4.1.1 Atopic dermatitis, eczema. Atopic dermatitis, also known as eczema, is one of the most prevalent skin allergies in infants. It is characterized by dry, itchy, and inflamed skin. Eczema often appears on the face, scalp, elbows, and knees, but it can affect any part of the body. The exact cause of eczema is unknown, but it is believed to be a combination of genetic and environmental factors. To manage eczema in infants, it is important to keep their skin moisturized. Use a gentle, fragrance-free moisturizer regularly to prevent dryness and itching. Avoid using harsh soaps or bubble baths that can further irritate the skin. Dress your baby in soft, breathable fabrics and keep their nails short to prevent scratching and potential infection. In some cases, certain triggers can worsen eczema symptoms. These triggers may include allergens such as dust mites, pet dander, pollen, or certain foods. Identifying and avoiding these triggers can help reduce flare-ups. If you suspect that a specific allergen is causing your baby's eczema, consult with a pediatrician or allergist for further evaluation and guidance. 4.1.2 Diaper rash allergies. Diaper rash is a common skin irritation that affects many infants. While most diaper rashes are caused by prolonged exposure to wetness or friction, some babies may develop an allergic reaction to certain diaper materials or ingredients in baby wipes, creams, or powders. This can result in a more severe and persistent rash. To prevent and treat diaper rash allergies, it is important to choose diapers and wipes that are hypoallergenic and free of fragrances, dyes, and other potential irritants. Change your baby's diaper frequently and allow their skin to air dry before putting on a fresh diaper. Use a gentle, hypoallergenic diaper cream to create a protective barrier between the skin and moisture. If your baby's diaper rash persists or worsens despite these measures, consult with a pediatrician. They can help determine if an allergic reaction is causing the rash and recommend appropriate treatment options. 4.1.3 Contact dermatitis. Contact dermatitis is a skin allergy that occurs when the skin comes into direct contact with an irritant or allergen. Common irritants include certain fabrics, soaps, detergents, lotions, and even saliva. Allergic contact dermatitis can be caused by substances such as nickel, latex, or certain chemicals found in skincare products. To manage contact dermatitis in infants, it is important to identify and avoid the specific irritants or allergens that trigger the reaction. Use gentle, fragrance-free skincare products and detergents specifically formulated for sensitive skin. When introducing new products, perform a patch test on a small area of your baby's skin to check for any adverse reactions. If your baby develops a rash or redness after coming into contact with a particular substance, consult with a pediatrician or allergist for further evaluation. They can help determine the cause of the reaction and provide guidance on how to avoid future exposure. 4.1.4 Heat rash Miliuria. Heat rash, also known as miliuria, is a common skin condition that occurs when sweat ducts become blocked, leading to small red bumps or blisters on the skin. It is particularly common in hot and humid climates or when babies are overdressed. To prevent heat rash, dress your baby in lightweight, breathable clothing and avoid overdressing them. Keep the room temperature cool and use a fan or air conditioning if necessary. If your baby develops heat rash, gently clean the affected area with mild soap and water, and keep it dry and cool. Avoid using creams or ointments that may further block the sweat ducts. In most cases, heat rash resolves on its own within a few days. However, if the rash persists or worsens, or if your baby shows signs of discomfort, consult with a pediatrician for further evaluation and guidance. Conclusion. Skin allergies can be a source of discomfort for infants, but with proper management and care, their symptoms can be alleviated. By understanding the common skin allergies in infants, such as atopic dermatitis, diaper rash allergies, contact dermatitis, and heat rash, parents can take proactive steps to prevent and address these conditions. If you have concerns about your baby's skin allergies, it is always best to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan. 4.2 Managing eczema and dermatitis in babies. Eczema and dermatitis are common skin conditions that can affect babies. These conditions can cause discomfort and distress for both the baby and the parents. In this section, we will discuss the management of eczema and dermatitis in babies, including tips for preventing flare-ups and soothing the baby's skin. 4.2.1 Understanding eczema and dermatitis. Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition that often begins in infancy. It is characterized by dry, itchy, and red patches of skin. Dermatitis, on the other hand, refers to inflammation of the skin that can be caused by various factors, including irritants, allergens, and genetic predisposition. Babies with eczema or dermatitis may experience symptoms such as dry and scaly skin, redness, itching, and the formation of small bumps or blisters. These symptoms can be uncomfortable for the baby and may lead to sleep disturbances and irritability. 4.2.2 Identifying triggers. One of the key aspects of managing eczema and dermatitis in babies is identifying and avoiding triggers that can worsen the condition. Common triggers include certain fabrics, such as wool or synthetic materials, harsh soaps or detergents, fragrances, pet dander, pollen, and certain foods. It can be helpful to keep a diary to track any potential triggers and note any changes in the baby's symptoms. This can assist in identifying patterns and determining which triggers to avoid. 4.2.3 Bathing and moisturizing. Proper bathing and moisturizing techniques are essential for managing eczema and dermatitis in babies. When bathing your baby, it is important to use lukewarm water and a mild, fragrance-free cleanser. Avoid using harsh soaps or bubble baths, as they can further dry out the skin. After bathing, gently pat the baby's skin dry with a soft towel and immediately apply a moisturizer. Look for a moisturizer that is specifically formulated for sensitive skin and free of fragrances and dyes. Applying the moisturizer while the skin is still slightly damp can help lock in moisture. 4.2.4 Clothing and fabrics. The choice of clothing and fabrics can play a significant role in managing eczema and dermatitis in babies. Opt for soft, breathable fabrics such as cotton or bamboo, as they are less likely to irritate the baby's skin. Avoid tight-fitting clothing and opt for loose, comfortable garments that allow the skin to breathe. It is also important to wash the baby's clothes with a gentle, hypoallergenic detergent that is free of fragrances and dyes. Rinse the clothes thoroughly to remove any residue that may irritate the baby's skin. 4.2.5 Avoiding irritants. In addition to identifying triggers, it is important to minimize exposure to irritants that can exacerbate eczema and dermatitis in babies. These irritants can include harsh soaps, detergents, and cleaning products. Opt for gentle, fragrance-free products that are specifically formulated for sensitive skin. It is also important to avoid exposing the baby to cigarette smoke, as it can worsen the symptoms of eczema and dermatitis. Keep the baby's environment clean and dust-free, as dust mites can also trigger flare-ups. 4.2.6 Treating flare-ups. Despite taking preventive measures, babies with eczema and dermatitis may still experience flare-ups. During these times, it is important to provide relief and soothe the baby's skin. One effective method is to apply a cool compress to the affected areas. This can help reduce itching and inflammation. Avoid scratching the baby's skin, as it can further irritate and worsen the condition. Instead, gently pat or rub the affected areas to provide relief. If the baby's symptoms persist or worsen, it is important to consult a healthcare professional. They may recommend a topical corticosteroid cream or ointment to reduce inflammation and relieve itching. It is important to follow the healthcare professional's instructions and use the medication as prescribed. 4.2.7 Seeking support. Managing eczema and dermatitis in babies can be challenging and overwhelming for parents. It is important to seek support from healthcare professionals, such as pediatricians or dermatologists, who can provide guidance and treatment options. Additionally, connecting with other parents who have experienced similar challenges can be beneficial. Online support groups or local parent support networks can provide a platform for sharing experiences, tips, and emotional support. Conclusion. Managing eczema and dermatitis in babies requires a multifaceted approach. By identifying triggers, practicing proper bathing and moisturizing techniques, choosing appropriate clothing and fabrics, avoiding irritants, and seeking support, parents can help alleviate the discomfort associated with these skin conditions. Remember, each baby is unique, and it may take some trial and error to find the most effective management strategies for your little one. With patience, persistence, and the right support, you can help your baby find relief from eczema and dermatitis. 4.3 Preventing and treating diaper rash allergies. Diaper rash is a common skin condition that affects many babies. It is characterized by redness, irritation, and discomfort in the diaper area. While diaper rash can have various causes, including prolonged exposure to wetness, friction, and bacterial or fungal infections, allergies can also play a role in its development. In this section, we will discuss how to prevent and treat diaper rash allergies in babies. 4.3.1 Understanding diaper rash allergies. Diaper rash allergies occur when a baby's skin reacts to certain substances present in diapers, wipes, or other products that come into contact with the diaper area. These substances can include fragrances, dyes, preservatives, or latex. When a baby's skin is sensitive or allergic to these substances, it can lead to the development of diaper rash. It is important to note that not all diaper rashes are caused by allergies. Other factors, such as poor hygiene, infrequent diaper changes, or certain medications, can also contribute to the development of diaper rash. However, if you suspect that your baby's diaper rash is due to an allergic reaction, it is essential to identify and eliminate the allergen to prevent further discomfort and irritation. 4.3.2 Preventing diaper rash allergies. Preventing diaper rash allergies involves taking proactive measures to minimize your baby's exposure to potential allergens. Here are some strategies to consider. Choose hypoallergenic diapers. Opt for diapers that are specifically labeled as hypoallergenic or fragrance-free. These diapers are less likely to contain irritants that can trigger an allergic reaction. Avoid scented wipes. Fragrances in wipes can be irritating to sensitive skin. Use fragrance-free wipes or consider using plain water and a soft cloth for cleaning during diaper changes. Use gentle detergents. Washcloth diapers, reusable diaper covers, and other fabric items that come into contact with your baby's skin using a mild, fragrance-free detergent. Harsh detergents can leave residue on the fabric, which may cause irritation. Change diapers frequently. Keeping your baby's diaper area clean and dry is crucial in preventing diaper rash. Change diapers promptly after they become wet or soiled to minimize the risk of irritation. Allow for diaper-free time. Give your baby some diaper-free time each day to allow their skin to breathe and reduce moisture buildup. Place a waterproof mat or towel underneath to catch any accidents. Be cautious with diaper creams. Some diaper rash creams may contain ingredients that can cause allergic reactions. Look for creams specifically formulated for sensitive skin or consult with your pediatrician before using any new products. 4.3.3 Treating diaper rash allergies. If your baby develops diaper rash allergies, it is important to take prompt action to alleviate their discomfort and promote healing. Here are some steps you can take. Identify the allergen. Try to determine the specific substance that is causing the allergic reaction. Consider any recent changes in diapers, wipes, or other products used in the diaper area. Once identified, eliminate the allergen from your baby's routine. Keep the area clean. Gently clean your baby's diaper area with warm water and a mild, fragrance-free cleanser during each diaper change. Avoid using wipes or products that may further irritate the skin. Apply a barrier cream. Use a hypoallergenic diaper rash cream or ointment to create a protective barrier between your baby's skin and the diaper. Look for products that are free from fragrances, dyes, and other potential allergens. Give diaper-free time. Allow your baby's skin to breathe by providing diaper-free time throughout the day. Place a waterproof mat or towel underneath to catch any messes. Use breathable diapers. Consider using cloth diapers or breathable disposable diapers that allow for better air circulation. Avoid tight-fitting diapers or plastic pants that can trap moisture and exacerbate the rash. Consult with a healthcare professional. If the diaper rash persists or worsens despite your efforts, it is advisable to seek guidance from your pediatrician or a dermatologist. They can provide further evaluation and recommend appropriate treatment options. Remember, every baby is unique, and what works for one may not work for another. It may take some trial and error to find the best prevention and treatment strategies for your baby's diaper rash allergies. By being attentive to your baby's needs and taking proactive measures, you can help alleviate their discomfort and promote healthy skin in the diaper area. 4.4 Addressing allergic reactions to skincare products. Babies have delicate and sensitive skin, which makes them more prone to developing allergic reactions to skincare products. As a parent, it is essential to be aware of the potential allergens in these products and take necessary precautions to prevent any adverse reactions. This section will provide you with valuable information on how to address and manage allergic reactions to skincare products in babies. 4.4.1 Understanding allergens in skincare products. Skincare products, such as lotions, creams, soaps, and shampoos, often contain various ingredients that can trigger allergic reactions in babies. These ingredients may include fragrances, preservatives, dyes, and certain chemicals. It is important to note that even products labeled as natural or hypoallergenic can still contain allergens that may cause a reaction in sensitive individuals. Fragrances are one of the most common allergens found in skincare products. They can be derived from natural sources or created synthetically. Fragrances can cause skin irritation, redness, itching, and even rashes in babies with sensitive skin. It is advisable to choose fragrance-free products or those specifically labeled as unscented to minimize the risk of an allergic reaction. Preservatives, such as parabens and formaldehyde-releasing agents, are added to skincare products to prevent the growth of bacteria and fungi. However, these preservatives can also cause allergic reactions in some babies. It is important to read the ingredient labels carefully and avoid products that contain these potential allergens. Dyes and certain chemicals, such as sodium lauryl sulfate (SLS) and phthalate, can also be problematic for babies with sensitive skin. These ingredients can cause skin irritation, dryness, and allergic reactions. Opting for products that are free from dyes and harsh chemicals can help reduce the risk of allergic reactions. 4.4.2 Identifying allergic reactions to skincare products. It is crucial for parents to be able to recognize the signs and symptoms of allergic reactions to skincare products in their babies. The most common symptoms include skin redness. Allergic reactions often manifest as redness on the skin. This can occur immediately after applying the product or develop gradually over time. Itching and irritation. Babies may experience intense itching and irritation in the areas where the product was applied. They may try to scratch or rub the affected areas to relieve the discomfort. Rash. Allergic reactions can cause a rash to develop on the skin. The rash may appear as small red bumps, hives, or patches of inflamed skin. It can be localized to the area where the product was applied or spread to other parts of the body. Swelling. In some cases, allergic reactions can cause swelling of the skin, especially around the eyes, lips, or face. This swelling may be accompanied by redness and itching. If you notice any of these symptoms after using a skincare product on your baby, it is important to discontinue its use immediately. Consult with your pediatrician or a dermatologist to determine the cause of the reaction and seek appropriate treatment. 4.4.3 Preventing allergic reactions to skincare products. Prevention is key when it comes to addressing allergic reactions to skincare products in babies. Here are some preventive measures you can take. Patch test. Before using a new skincare product on your baby, perform a patch test. Apply a small amount of the product on a small area of your baby's skin, such as the inner forearm, and wait for 24 to 48 hours. If no reaction occurs, it is generally safe to use the product. Read labels. Always read the ingredient labels of skincare products before using them on your baby. Look for products that are free from potential allergens, such as fragrances, preservatives, dyes, and harsh chemicals. Choose gentle and hypoallergenic products. Opt for skincare products specifically formulated for babies with sensitive skin. These products are often labeled as gentle or hypoallergenic and are less likely to cause allergic reactions. Perform a product elimination test. If you suspect that a particular skincare product is causing an allergic reaction in your baby, eliminate it from their routine for a period of time and observe if the symptoms improve. If the symptoms disappear, it is likely that the product was the cause of the reaction. Seek professional advice. If you are unsure about which skincare products are safe for your baby or if your baby has a history of severe allergic reactions, consult with a pediatrician or dermatologist. They can recommend suitable products and provide guidance on managing your baby's skincare routine. Remember, every baby is unique, and what works for one may not work for another. It may take some trial and error to find the right skincare products that suit your baby's skin. By being vigilant and proactive, you can help protect your baby from allergic reactions to skincare products and ensure their skin remains healthy and irritation-free. 5. Respiratory allergies in babies. 5.1 Understanding respiratory allergens. Respiratory allergies in babies can be a cause of concern for parents. These allergies are triggered by various substances present in the air that are inhaled by the baby, leading to an allergic reaction in the respiratory system. Understanding the different respiratory allergens and their effects on infants is crucial in managing and preventing these allergies. 5.1.1 Common respiratory allergens. There are several common respiratory allergens that can affect babies. These allergens can be found both indoors and outdoors. Let's take a closer look at some of the most prevalent respiratory allergens. 5.1.1.1 Dust mites. Dust mites are tiny creatures that thrive in warm and humid environments. They are commonly found in bedding, carpets, and upholstered furniture. When babies inhale dust mite allergens, it can trigger an allergic reaction, leading to symptoms such as sneezing, coughing, and wheezing. 5.1.1.2 Pollen. Pollen is a common outdoor allergen that is released by plants during certain times of the year. When babies with respiratory allergies come into contact with pollen, it can cause symptoms such as a runny nose, itchy eyes, and difficulty breathing. 5.1.1.3 Mold. Mold is a type of fungus that can grow in damp and humid environments, such as bathrooms and basements. When babies inhale mold spores, it can lead to respiratory allergies. Symptoms may include coughing, wheezing, and nasal congestion. 5.1.1.4 Pet dander. Pet dander refers to the tiny particles of skin, hair, or feathers that animals shed. Babies who are allergic to pet dander may experience symptoms such as sneezing, itching, and difficulty breathing when exposed to pets. 5.1.1.5 Smoke. Exposure to smoke, whether from tobacco or wood-burning stoves, can trigger respiratory allergies in babies. The irritants in smoke can cause symptoms such as coughing, wheezing, and chest tightness. 5.1.2 Effects of respiratory allergens on babies. Respiratory allergens can have various effects on babies, ranging from mild to severe. It is important for parents to be aware of these effects in order to identify and manage respiratory allergies in their infants. 5.1.2.1 Nasal symptoms. One of the most common effects of respiratory allergens on babies is nasal symptoms. These may include a runny or stuffy nose, sneezing, and itching. Babies may also rub their noses frequently in an attempt to alleviate the discomfort caused by the allergens. 5.1.2.2 Respiratory symptoms. Respiratory allergens can also affect the lower respiratory tract, leading to symptoms such as coughing, wheezing, and shortness of breath. In some cases, babies may develop asthma-like symptoms, which can be triggered by exposure to certain allergens. 5.1.2.3 Skin symptoms. In addition to respiratory symptoms, some babies may also experience skin symptoms as a result of respiratory allergens. These symptoms may include redness, itching, and rashes on the skin. It is important to note that skin symptoms can occur due to direct contact with allergens or as a secondary reaction to respiratory allergies. 5.1.3 Managing respiratory allergies in babies. Managing respiratory allergies in babies involves a combination of prevention and treatment strategies. Here are some tips to help parents effectively manage respiratory allergies in their infants. 5.1.3.1 Allergen avoidance. The first step in managing respiratory allergies is to identify and avoid the allergens that trigger the symptoms. This may involve making changes to the baby's environment, such as using hypoallergenic bedding, keeping pets out of the baby's room, and regularly cleaning and vacuuming to reduce dust mites and mold. 5.1.3.2 Air filtration. Using air purifiers or filters can help remove allergens from the air, creating a cleaner and healthier environment for the baby. It is important to choose a high-quality air purifier that is specifically designed to capture allergens such as dust mites, pollen, and pet dander. 5.1.3.3 Medications. In some cases, medications may be necessary to manage respiratory allergies in babies. Antihistamines can help relieve symptoms such as sneezing and itching, while nasal corticosteroids can reduce inflammation in the nasal passages. It is important to consult with a pediatrician before giving any medications to a baby. 5.1.3.4 Allergy immunotherapy. For severe respiratory allergies, allergy immunotherapy may be recommended. This involves exposing the baby to small amounts of the allergen over time, gradually desensitizing their immune system. Allergy shots or sublingual immunotherapy tablets may be prescribed by a pediatric allergist. Conclusion. Understanding respiratory allergens and their effects on babies is essential for parents in managing and preventing respiratory allergies. By identifying common allergens, recognizing the symptoms, and implementing appropriate management strategies, parents can help their babies breathe easier and live a healthier life. 5.2 Recognizing and managing allergic rhinitis in infants. Allergic rhinitis, commonly known as hay fever, is a type of respiratory allergy that affects many infants. It is characterized by inflammation of the nasal passages due to an allergic reaction to certain substances in the environment. These substances, known as allergens, can include pollen, dust mites, pet dander, and mold spores. Allergic rhinitis can cause a range of symptoms in infants, including sneezing, a runny or stuffy nose, itching, and watery eyes. 5.2.1 Identifying allergic rhinitis in infants. Recognizing allergic rhinitis in infants can be challenging, as they may not be able to communicate their symptoms effectively. However, there are certain signs that parents can look out for to determine if their baby is experiencing allergic rhinitis. These signs include frequent sneezing. If your baby is sneezing frequently, especially in response to specific triggers such as being outdoors or being around pets, it could be a sign of allergic rhinitis. Persistent nasal congestion. If your baby's nose is constantly blocked or stuffy, and this congestion lasts for an extended period, it may be due to allergic rhinitis. Watery eyes. Excessive tearing or watery eyes, especially when your baby is exposed to allergens, can be indicative of allergic rhinitis. Itchy nose or throat. If your baby frequently rubs their nose or throat, or seems to be bothered by an itchy sensation in these areas, it could be a symptom of allergic rhinitis. Dark circles under the eyes. Allergic rhinitis can cause a condition known as allergic shiners, which presents as dark circles under the eyes. This is due to the congestion and inflammation in the nasal passages. If you notice any of these symptoms in your infant, it is important to consult with a healthcare professional for a proper diagnosis. 5.2.2 Managing allergic rhinitis in infants. While there is no cure for allergic rhinitis, there are several strategies that parents can employ to manage their baby's symptoms and provide relief. Here are some effective management techniques. Allergen avoidance. The first step in managing allergic rhinitis is to identify and minimize your baby's exposure to allergens. This may involve keeping windows closed during high pollen seasons, using allergen-proof bedding and pillow covers, and regularly cleaning and vacuuming your home to reduce dust mites and pet dander. Nasal saline rinses. Saline nasal rinses can help alleviate nasal congestion and remove allergens from the nasal passages. Using a saline solution specifically designed for infants, gently flush your baby's nose with the solution to provide relief. Humidifiers. Dry air can worsen the symptoms of allergic rhinitis. Using a humidifier in your baby's room can help keep the air moist, reducing nasal irritation and congestion. Medications. In some cases, healthcare professionals may recommend over-the-counter or prescription medications to manage your baby's allergic rhinitis symptoms. These may include antihistamines, nasal corticosteroids, or decongestants. However, it is crucial to consult with a healthcare professional before giving any medication to your infant. Allergy shots. Allergy shots, also known as immunotherapy, may be considered for infants with severe allergic rhinitis that does not respond to other treatments. This involves regular injections of small amounts of allergens to desensitize the immune system over time. Breastfeeding. Breastfeeding has been shown to have a protective effect against the development of allergies, including allergic rhinitis. If you are breastfeeding, continue to do so as it can help strengthen your baby's immune system. Clean environment. Keeping your baby's environment clean and free from dust, pet dander, and other allergens is essential in managing allergic rhinitis. Regularly dust and vacuum your home, wash bedding in hot water, and keep pets out of your baby's sleeping area. Remember, it is crucial to consult with a healthcare professional before implementing any management strategies or giving medication to your baby. They will be able to provide personalized advice and guidance based on your baby's specific needs. By effectively recognizing and managing allergic rhinitis in infants, parents can help alleviate their baby's discomfort and improve their overall quality of life. With proper care and attention, allergic rhinitis can be effectively managed, allowing your baby to thrive and enjoy a healthy, allergy-free childhood. 5.3 Dealing with asthma and allergies in babies. Asthma is a chronic respiratory condition that affects people of all ages, including infants. It is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, shortness of breath, and chest tightness. In babies, asthma can be particularly challenging to diagnose and manage due to their limited ability to communicate their symptoms. However, with proper understanding and proactive measures, parents can effectively deal with asthma and allergies in their babies. 5.3.1 Recognizing asthma symptoms in babies. Identifying asthma symptoms in babies can be challenging as they may not be able to express their discomfort clearly. However, there are certain signs that parents can look out for. Frequent coughing. Babies with asthma may have a persistent cough, especially during the night or after physical activity. Wheezing. Wheezing is a high-pitched whistling sound that occurs when air flows through narrowed airways. It can be heard when the baby breathes out. Rapid breathing. Babies with asthma may have rapid or shallow breathing. Chest retractions. The skin between the ribs or above the collarbone may appear to sink in with each breath. Difficulty feeding. Babies with asthma may have difficulty feeding or may refuse to eat due to breathing difficulties. Frequent respiratory infections. Babies with asthma may experience more frequent respiratory infections, such as colds or bronchiolitis. If you notice any of these symptoms in your baby, it is important to consult a healthcare professional for a proper diagnosis. 5.3.2 Diagnosing asthma in babies. Diagnosing asthma in babies can be challenging because their symptoms can be similar to other respiratory conditions. A healthcare professional will consider the baby's medical history, family history of asthma or allergies, and perform a physical examination. They may also recommend the following diagnostic tests. Lung function tests. These tests measure how well the baby's lungs are functioning. However, these tests are usually not performed in infants due to their inability to cooperate. Chest X-ray or CT scan. These imaging tests can help rule out other respiratory conditions and assess the condition of the lungs. Allergy testing. Allergy testing may be recommended to identify specific allergens that could be triggering the baby's asthma symptoms. It is important to work closely with a healthcare professional to ensure an accurate diagnosis and appropriate management plan for your baby. 5.3.3 Managing asthma and allergies in babies. Once your baby has been diagnosed with asthma, there are several strategies you can implement to effectively manage their condition and reduce the frequency and severity of asthma attacks. Avoid triggers. Identify and minimize exposure to common triggers such as dust mites, pet dander, pollen, mold, and tobacco smoke. Keep the baby's environment clean and free from potential allergens. Create an asthma-friendly home. Ensure good indoor air quality by using air purifiers, keeping humidity levels in check, and regularly cleaning bedding and stuffed toys. Follow a medication plan. Your healthcare professional may prescribe medications such as bronchodilators or inhaled corticosteroids to help manage your baby's asthma symptoms. It is important to follow the prescribed dosage and administration instructions. Monitor symptoms. Keep track of your baby's symptoms, triggers, and medication usage in a diary. This can help you identify patterns and make necessary adjustments to their management plan. Emergency Action Plan. Work with your healthcare professional to develop an emergency action plan that outlines what steps to take in case of a severe asthma attack. Share this plan with caregivers, family members, and anyone who regularly interacts with your baby. Regular checkups. Schedule regular follow-up appointments with your healthcare professional to monitor your baby's asthma and make any necessary adjustments to their management plan. Remember, managing asthma and allergies in babies requires a collaborative effort between parents, healthcare professionals, and caregivers. By staying vigilant, creating a safe environment, and following the prescribed management plan, you can help your baby lead a healthy and active life despite their condition. 5.4 Preventing respiratory allergies in the home. Respiratory allergies, such as allergic rhinitis and asthma, can cause significant discomfort and distress for babies. These allergies are often triggered by common allergens found in the home environment, such as dust mites, pet dander, mold, and pollen. As a parent, there are several steps you can take to minimize your baby's exposure to these allergens and prevent respiratory allergies from developing or worsening. By creating a clean and allergen-free home environment, you can help your baby breathe easier and reduce the risk of respiratory allergies. 5.4.1 Keep the home clean and dust-free. Dust mites are one of the most common triggers for respiratory allergies in babies. These microscopic creatures thrive in warm and humid environments, such as bedding, carpets, and upholstered furniture. To minimize dust mite exposure, it is important to keep your home clean and dust-free. Here are some tips. Regularly vacuum carpets, rugs, and upholstery using a vacuum cleaner with a HEPA filter. This will help to trap and remove dust mites and their allergens effectively. Wash bedding, including sheets, blankets, and pillowcases, in hot water at least 130 degrees Fahrenheit or 54 degrees Celsius weekly to kill dust mites. Use allergen-proof covers on mattresses, pillows, and duvets to create a barrier between your baby and dust mites. Avoid using stuffed animals or soft toys in your baby's bedroom, as they can harbor dust mites. If your baby has a favorite stuffed animal, wash it regularly in hot water or freeze it overnight to kill any dust mites. 5.4.2 Control humidity levels. Maintaining optimal humidity levels in your home can help prevent the growth of mold and reduce the presence of dust mites. Mold spores can trigger respiratory allergies in babies, so it is essential to keep humidity levels in check. Here's what you can do. Use a dehumidifier in damp areas of your home, such as the basement or bathroom, to reduce moisture levels and inhibit mold growth. Keep indoor humidity levels between 30% and 50% to discourage the proliferation of dust mites and mold. Fix any leaks or water damage promptly to prevent the growth of mold. 5.4.3 Minimize pet allergens. If you have pets at home, their dander can be a significant trigger for respiratory allergies in babies. While it may be challenging to completely eliminate pet allergens, there are steps you can take to minimize exposure. Keep pets out of your baby's bedroom and other areas where they spend a lot of time. Regularly groom and bathe your pets to reduce the amount of dander they shed. Vacuum and dust your home frequently to remove pet dander from surfaces. Consider using air purifiers with HEPA filters to help remove pet allergens from the air. 5.4.4 Maintain good indoor air quality. Improving indoor air quality can significantly reduce the risk of respiratory allergies in babies. Here are some measures you can take. Open windows regularly to allow fresh air to circulate and reduce the concentration of indoor allergens. Use exhaust fans in the kitchen and bathroom to remove moisture and odors. Avoid smoking or allowing others to smoke in your home, as secondhand smoke can worsen respiratory allergies. Use high-efficiency air filters in your heating and cooling systems to trap allergens and improve air quality. 5.4.5 Regularly clean and maintain HVAC systems. Heating, ventilation, and air conditioning (HVAC) systems can harbor allergens if not properly maintained. To prevent respiratory allergies, it is important to keep these systems clean and in good working condition. Change air filters regularly according to the manufacturer's instructions to prevent the buildup of allergens. Schedule regular professional maintenance for your HVAC system to ensure it is clean and functioning optimally. Clean air ducts and vents periodically to remove accumulated dust and allergens. 5.4.6 Avoid environmental triggers. In addition to common indoor allergens, certain environmental triggers can worsen respiratory allergies in babies. Here are some precautions you can take. Keep windows closed during high pollen seasons to minimize exposure to outdoor allergens. Limit your baby's time outdoors on days with high pollen counts or during peak allergy seasons. Use air purifiers with HEPA filters in your baby's bedroom to help remove airborne allergens. Avoid using strong-smelling cleaning products, perfumes, or scented candles, as they can irritate the respiratory system. By implementing these preventive measures, you can create a healthier and more allergen-free environment for your baby. However, it is important to remember that every baby is different, and what works for one may not work for another. If your baby continues to experience respiratory allergy symptoms despite your efforts, consult with a pediatrician or allergist for further evaluation and guidance. 6. Medication allergies in babies. 6.1 Common medications that cause allergic reactions in infants. When it comes to managing allergies in babies, it is important to be aware of the potential allergens that can trigger a reaction. While many people associate allergies with food or environmental factors, it is also crucial to consider the medications that infants may be exposed to. Certain medications can cause allergic reactions in babies, and it is essential for parents and caregivers to be informed about these potential allergens. Allergic reactions to medications can range from mild to severe, and they can occur immediately or develop over time. It is important to note that not all babies will have an allergic reaction to these medications, but it is crucial to be aware of the potential risks. Here are some common medications that can cause allergic reactions in infants. 6.1.1 Antibiotics. Antibiotics are commonly prescribed to treat bacterial infections in babies. While they are effective in fighting infections, some infants may develop allergic reactions to certain types of antibiotics. Penicillin and cephalosporin antibiotics are known to cause allergic reactions in some individuals, including babies. Symptoms of an allergic reaction to antibiotics may include rash, hives, swelling, difficulty breathing, or gastrointestinal issues. If your baby has a known allergy to antibiotics, it is important to inform their healthcare provider to avoid any potential complications. 6.1.2 Nonsteroidal anti-inflammatory drugs, NSAIDs. Nonsteroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are commonly used to relieve pain, reduce fever, and alleviate inflammation. While these medications are generally safe for infants when used as directed, some babies may develop allergic reactions to NSAIDs. Symptoms of an allergic reaction to NSAIDs may include rash, hives, swelling, wheezing, or difficulty breathing. If your baby experiences any of these symptoms after taking an NSAID, it is important to seek medical attention immediately. 6.1.3 Acetaminophen. Acetaminophen, also known as paracetamol, is a commonly used medication to relieve pain and reduce fever in infants. While it is generally considered safe, some babies may develop allergic reactions to acetaminophen. Symptoms of an allergic reaction to acetaminophen may include rash, hives, swelling, or difficulty breathing. If your baby experiences any of these symptoms after taking acetaminophen, it is important to consult their healthcare provider. 6.1.4 Vaccines. Vaccines are an essential part of a baby's healthcare routine, as they help protect against various diseases. While vaccines are generally safe, some infants may develop allergic reactions to certain vaccine components. Allergic reactions to vaccines are rare but can occur. Symptoms of an allergic reaction to vaccines may include rash, hives, swelling, difficulty breathing, or anaphylaxis. It is important to discuss any known allergies or previous adverse reactions with your baby's healthcare provider before administering vaccines. 6.1.5 Antihistamines. Antihistamines are commonly used to relieve allergy symptoms such as sneezing, itching, and runny nose. While antihistamines are generally safe for infants when used as directed, some babies may develop allergic reactions to these medications. Symptoms of an allergic reaction to antihistamines may include rash, hives, swelling, or difficulty breathing. If your baby experiences any of these symptoms after taking an antihistamine, it is important to seek medical attention. 6.1.6 Steroids. Steroids, such as corticosteroids, are often prescribed to reduce inflammation and manage various allergic conditions in infants. While steroids can be effective in treating allergies, some babies may develop allergic reactions to these medications. Symptoms of an allergic reaction to steroids may include rash, hives, swelling, or difficulty breathing. If your baby experiences any of these symptoms after taking steroids, it is important to consult their healthcare provider. It is important to remember that allergic reactions to medications can vary from person to person. Some babies may have a higher risk of developing allergic reactions due to a family history of allergies or previous adverse reactions. If you suspect that your baby may be experiencing an allergic reaction to a medication, it is crucial to seek medical attention promptly. In conclusion, while medications can be beneficial in treating various conditions in infants, it is important to be aware of the potential allergens they may contain. Antibiotics, nonsteroidal anti-inflammatory drugs, acetaminophen, vaccines, antihistamines, and steroids are some common medications that can cause allergic reactions in infants. If you have any concerns or suspect that your baby may be experiencing an allergic reaction to a medication, it is important to consult their healthcare provider for proper evaluation and guidance. 6.2 Identifying and managing medication allergies in babies. Medication allergies in babies can be a cause for concern for parents and caregivers. It is important to be aware of the signs and symptoms of medication allergies in infants and to know how to manage them effectively. In this section, we will discuss how to identify and manage medication allergies in babies. 6.2.1 Signs and symptoms of medication allergies in babies. Medication allergies in babies can manifest in various ways. It is essential to be vigilant and observe any changes in your baby's behavior or physical appearance after administering medication. Some common signs and symptoms of medication allergies in babies include skin reactions. Allergic reactions to medications can often cause skin rashes, hives, or itching. These reactions may appear shortly after taking the medication or may develop over time. Respiratory symptoms. Medication allergies can also affect the respiratory system, leading to symptoms such as wheezing, coughing, or difficulty breathing. If your baby experiences any of these symptoms after taking medication, it is important to seek medical attention immediately. Digestive issues. Some babies may develop gastrointestinal symptoms like vomiting, diarrhea, or stomach pain as a result of a medication allergy. These symptoms can be distressing for both the baby and the caregiver. Swelling. In rare cases, medication allergies can cause swelling of the face, lips, tongue, or throat. This can be a serious allergic reaction known as anaphylaxis and requires immediate medical attention. 6.2.2 Common medications that cause allergic reactions in infants. While any medication has the potential to cause an allergic reaction, certain types of medications are more commonly associated with allergies in infants. It is important to be aware of these medications and their potential side effects. Some common medications that can cause allergic reactions in babies include antibiotics. Antibiotics such as penicillin, amoxicillin, and cephalosporins are known to cause allergic reactions in some infants. These reactions can range from mild rashes to severe anaphylaxis. Nonsteroidal anti-inflammatory drugs (NSAIDs), medications like ibuprofen and aspirin, which are commonly used to reduce fever and relieve pain, can also trigger allergic reactions in some babies. Anticonvulsants. Certain anticonvulsant medications used to treat seizures in infants can cause allergic reactions. It is important to monitor your baby closely if they are prescribed these medications. Vaccines. While rare, some babies may develop allergic reactions to certain vaccines. It is important to discuss any concerns or family history of vaccine allergies with your pediatrician before immunization. 6.2.3 Managing medication allergies in babies. If you suspect that your baby is experiencing a medication allergy, it is crucial to seek medical attention promptly. The following steps can help in managing medication allergies in babies. Stop the medication. If you notice any signs or symptoms of an allergic reaction after administering medication to your baby, discontinue its use immediately. Contact your pediatrician or seek emergency medical care if the reaction is severe. Seek medical advice. Contact your pediatrician or healthcare provider to discuss the symptoms and seek guidance on how to manage the allergic reaction. They may recommend alternative medications or treatments. Keep a record. Maintain a detailed record of the medication your baby had, the dosage, and the symptoms they experienced. This information will be valuable for your healthcare provider in determining the cause of the allergic reaction. Avoid the allergen. Once a medication allergy has been identified, it is important to avoid that specific medication in the future. Inform all healthcare providers about the allergy to prevent any accidental exposure. Consider alternative medications. In some cases, your healthcare provider may recommend alternative medications that are less likely to cause an allergic reaction. It is important to discuss the options and potential risks with your healthcare provider. Educate caregivers. If your baby attends daycare or is under the care of other caregivers, it is crucial to inform them about the medication allergy. Provide clear instructions on what to do in case of an allergic reaction and ensure they have access to any necessary medications or emergency contacts. Medical alert bracelet. For severe medication allergies, it may be beneficial to have your baby wear a medical alert bracelet or necklace indicating the allergy. This can help alert healthcare providers in case of an emergency. Remember, always consult with your healthcare provider for proper diagnosis and management of medication allergies in babies. They will be able to provide personalized advice based on your baby's specific needs and medical history. In the next section, we will explore alternative medications for allergic babies, providing options for parents and caregivers to consider when managing allergies in infants. 6.3 Alternative medications for allergic babies. When it comes to managing allergies in babies, medication is often a necessary part of the treatment plan. However, some parents may be concerned about the potential side effects of conventional medications or may be looking for alternative options. In this section, we will explore some alternative medications that can be used to alleviate allergy symptoms in allergic babies. 6.3.1 Herbal remedies. Herbal remedies have been used for centuries to treat various ailments, including allergies. While there is limited scientific evidence to support their effectiveness, some parents find them to be a helpful addition to their baby's allergy management plan. It is important to note that herbal remedies should be used with caution and under the guidance of a healthcare professional, as they can interact with other medications or cause allergic reactions in some individuals. Quercetin. Quercetin is a natural compound found in many fruits and vegetables, such as apples, onions, and berries. It is believed to have anti-inflammatory and antihistamine properties, which can help reduce allergy symptoms. Quercetin supplements are available in capsule or liquid form and can be considered as an alternative to conventional antihistamines for allergic babies. Butterbur. Butterbur is a plant native to Europe and Asia that has been used for centuries to treat allergies and migraines. It contains active compounds that have been shown to inhibit the release of histamine, a key player in allergic reactions. Butterbur supplements are available in tablet or capsule form and can be used as an alternative to antihistamines for allergic babies. Stinging nettle. Stinging nettle is a plant that has been used in traditional medicine to treat allergies and other inflammatory conditions. It contains bioactive compounds that have been shown to reduce the production of inflammatory chemicals in the body. Stinging nettle supplements are available in capsule or tea form and can be considered as an alternative to conventional allergy medications for allergic babies. 6.3.2 Homeopathic remedies. Homeopathy is a system of alternative medicine that uses highly diluted substances to stimulate the body's natural healing processes. While the scientific evidence for homeopathy is controversial, some parents find it to be a gentle and non-invasive approach to managing allergies in babies. It is important to consult with a qualified homeopath before using any homeopathic remedies for your baby. Allium cepa. Allium cepa, also known as red onion, is a homeopathic remedy commonly used to treat allergic rhinitis. It is believed to help relieve symptoms such as sneezing, runny nose, and watery eyes. Allium cepa is available in pellet or liquid form and can be considered as an alternative to conventional nasal sprays or antihistamines for allergic babies. Euphrasia. Euphrasia, also known as eyebright, is a homeopathic remedy often used to treat eye allergies. It is believed to help relieve symptoms such as itching, redness, and watering of the eyes. Euphrasia is available in pellet or liquid form and can be considered as an alternative to conventional eye drops for allergic babies. Apis mellifica. Apis mellifica, also known as honeybee venom, is a homeopathic remedy used to treat allergic reactions characterized by swelling, redness, and stinging pain. It is believed to help reduce inflammation and relieve symptoms such as hives or swelling of the lips and face. Apis mellifica is available in pellet or liquid form and can be considered as an alternative to conventional antihistamines for allergic babies. 6.3.3 Probiotics. Probiotics are live bacteria and yeasts that are beneficial for the digestive system. They have been studied for their potential role in modulating the immune system and reducing the risk of allergies. While more research is needed to fully understand their effectiveness, some studies suggest that probiotics may help alleviate allergy symptoms in infants. Probiotics can be found in certain foods, such as yogurt and fermented vegetables, or taken as supplements. When choosing a probiotic supplement for your baby, it is important to select a product specifically formulated for infants and consult with a healthcare professional for guidance. 6.3.4 Acupuncture. Acupuncture is a traditional Chinese medicine practice that involves inserting thin needles into specific points on the body. It is believed to help balance the body's energy flow and promote healing. While there is limited scientific evidence to support its effectiveness in treating allergies, some parents find acupuncture to be a safe and gentle option for their allergic babies. If you are considering acupuncture for your baby, it is important to seek out a qualified and experienced practitioner who has experience working with infants. They will be able to provide guidance on the appropriate treatment plan and ensure the safety and comfort of your baby during the sessions. In conclusion, alternative medications can be considered as part of the allergy management plan for allergic babies. However, it is important to consult with a healthcare professional before introducing any alternative medications to ensure their safety and effectiveness. Additionally, alternative medications should not be used as a substitute for conventional medical treatment but rather as a complementary approach to alleviate allergy symptoms in allergic babies. 7. Allergy testing in babies. 7.1 Types of allergy tests for infants. When it comes to identifying allergies in infants, allergy testing plays a crucial role. Allergy tests help healthcare professionals determine the specific allergens that may be causing an allergic reaction in babies. By pinpointing the allergens, parents and healthcare providers can develop an effective management plan to minimize exposure and prevent future allergic reactions. In this section, we will explore the different types of allergy tests available for infants. 7.1.1 Skin prick test. The skin prick test, also known as a puncture or scratch test, is one of the most common allergy tests performed on infants. This test involves placing a small amount of allergen extract on the skin, usually on the back or forearm, and then gently pricking or scratching the surface of the skin. If the baby is allergic to the specific allergen, a small raised bump, similar to a mosquito bite, will appear within 15 to 20 minutes. The size of the bump helps determine the severity of the allergy. The skin prick test is safe and generally well tolerated by infants. However, it is important to note that this test should only be performed by a trained healthcare professional in a controlled environment to ensure accurate results and minimize the risk of adverse reactions. 7.1.2 Blood test. In some cases, a blood test may be recommended to diagnose allergies in infants. The most common blood test used for allergy testing is called the immunicap test, which measures the levels of specific IgE antibodies in the blood. IgE antibodies are produced by the immune system in response to allergens. During the blood test, a small sample of the baby's blood is drawn and sent to a laboratory for analysis. The lab technicians will measure the levels of IgE antibodies specific to various allergens. The results are then interpreted by the healthcare provider to determine which allergens the baby is allergic to. Blood tests are particularly useful when the baby has a skin condition that may interfere with the accuracy of the skin prick test, or if the baby is unable to tolerate the skin prick test due to other medical reasons. 7.1.3 Elimination diet. In some cases, an elimination diet may be recommended to identify food allergies in infants. This involves removing certain foods from the baby's diet for a period of time and then reintroducing them one at a time to observe any allergic reactions. The elimination diet is typically done under the guidance of a healthcare professional or a registered dietitian to ensure that the baby receives adequate nutrition during the process. This type of allergy testing is often used when other tests are inconclusive or when there is a suspicion of multiple food allergies. It is important to note that an elimination diet should only be conducted under medical supervision, as it can be challenging to ensure the baby's nutritional needs are met while avoiding specific foods. 7.1.4 Oral Food Challenge. An oral food challenge is a controlled test that involves giving the baby small amounts of a suspected allergenic food under medical supervision. This test is typically performed in a hospital or clinic setting, where the baby's vital signs can be closely monitored. During the oral food challenge, the baby is given increasing amounts of the suspected allergenic food over a period of time. The healthcare provider will observe the baby for any signs of an allergic reaction, such as hives, wheezing, or gastrointestinal symptoms. If an allergic reaction occurs, the challenge is stopped, and appropriate medical intervention is provided. The oral food challenge is considered the gold standard for diagnosing food allergies, as it provides the most accurate and definitive results. However, it should only be performed by trained healthcare professionals who are experienced in managing allergic reactions. 7.1.5 Patch Test. Patch testing is a type of allergy test used to diagnose contact dermatitis, a type of skin allergy caused by direct contact with certain substances. This test is typically performed on older infants who have developed a rash or skin irritation in response to a specific substance. During the patch test, small amounts of various allergens are applied to adhesive patches, which are then placed on the baby's back. The patches are left in place for a specific period, usually 48 hours, and then removed. The healthcare provider will examine the skin for any signs of an allergic reaction, such as redness, swelling, or a rash. Patch testing is not commonly performed on infants, as their skin is more sensitive and may not provide accurate results. However, in certain cases, it may be recommended by a dermatologist or allergist. 7.1.6 Component Resolved Diagnosis. Component resolved diagnosis is a newer type of allergy testing that aims to identify specific proteins within allergens that trigger allergic reactions. This test can provide more detailed information about the specific components of an allergen that the baby is allergic to. Component resolved diagnosis is typically performed using a blood sample, similar to the blood test mentioned earlier. The blood sample is analyzed for specific IgE antibodies against individual allergenic components. This type of testing is particularly useful in cases where the baby has multiple allergies or when the standard allergy tests yield inconclusive results. It is important to note that component-resolved diagnosis is not widely available and may only be offered by specialized allergy clinics or research institutions. In conclusion, there are several types of allergy tests available for infants, including the skin prick test, blood test, elimination diet, oral food challenge, patch test, and component-resolved diagnosis. Each test has its own advantages and limitations, and the choice of test will depend on the baby's specific symptoms, medical history, and the suspected allergens. It is important to consult with a healthcare professional or allergist to determine the most appropriate allergy testing method for your baby. 7.2 When and how to test for allergies in babies. Testing for allergies in babies can be a crucial step in identifying and managing their allergic reactions. Allergies can cause discomfort and distress for infants, and it is important for parents and healthcare professionals to be able to pinpoint the specific allergens that are triggering these reactions. This section will discuss when and how to test for allergies in babies, providing parents with valuable information to help them navigate this process. 7.2.1 Signs that your baby may need allergy testing. It can be challenging to determine whether your baby's symptoms are caused by allergies or other factors. However, there are certain signs that may indicate the need for allergy testing. Persistent symptoms. If your baby consistently experiences symptoms such as rashes, hives, wheezing, coughing, sneezing, or gastrointestinal issues, it may be a sign of an underlying allergy. Family history of allergies. If you or your partner have a history of allergies, asthma, eczema, or other allergic conditions, your baby may be at a higher risk of developing allergies. Delayed onset of symptoms. Allergic reactions can sometimes take time to manifest. If your baby's symptoms appear a few hours or even days after exposure to a potential allergen, it may be an indication of an allergy. Failure to respond to standard treatments. If your baby's symptoms persist despite standard treatments, such as over-the-counter medications or changes in diet, it may be necessary to explore the possibility of allergies. If you notice any of these signs in your baby, it is important to consult with a healthcare professional who specializes in allergies and immunology. They can help determine whether allergy testing is necessary and guide you through the process. 7.2.2 Types of allergy tests for babies. There are several different types of allergy tests that can be performed on babies to identify specific allergens. The most common tests include skin prick test. This test involves placing a small amount of allergen extract on the skin, usually on the back or forearm, and then pricking or scratching the skin to allow the allergen to enter. If your baby is allergic to the substance, a small raised bump, similar to a mosquito bite, will appear within 15 to 20 minutes. Blood test. A blood test, also known as a specific IgE test, measures the level of allergen-specific antibodies in your baby's blood. This test can help identify specific allergens that may be causing your baby's allergic reactions. Elimination diet. In some cases, an elimination diet may be recommended to identify food allergies. This involves removing suspected allergens from your baby's diet for a period of time and then reintroducing them one by one to observe any allergic reactions. Oral food challenge. This test is typically performed under medical supervision and involves giving your baby small amounts of a suspected allergen to see if they have a reaction. It is considered the gold standard for diagnosing food allergies. The choice of which test to use will depend on various factors, including your baby's age, medical history, and the suspected allergens. Your healthcare professional will guide you in selecting the most appropriate test for your baby. 7.2.3 Preparing for allergy testing. Before your baby undergoes allergy testing, there are a few important steps to take to ensure accurate results. Consult with a specialist. It is essential to consult with a healthcare professional who specializes in allergies and immunology. They will assess your baby's symptoms, medical history, and family history to determine the most appropriate testing approach. Avoid antihistamines. If your baby is taking antihistamines, it is important to stop their use for a specific period of time before the allergy test. Antihistamines can interfere with the accuracy of the results. Keep a symptom diary. Before the test, it can be helpful to keep a diary of your baby's symptoms, including when they occur and any potential triggers. This information can assist the healthcare professional in identifying the most likely allergens to test for. Comfort and distraction. Allergy testing can be uncomfortable for babies, especially during the skin prick test. Bringing along comfort items, such as a favorite toy or blanket, can help soothe your baby during the procedure. 7.2.4 What to expect during allergy testing. The process of allergy testing can vary depending on the type of test being performed. Here is an overview of what you can expect during each test. Skin prick test. During a skin prick test, a small drop of allergen extract is placed on your baby's skin, and then a tiny needle or lancet is used to prick or scratch the skin. This is usually done on the back or forearm. The test is generally well tolerated by babies and causes minimal discomfort. Blood test. A blood sample will be taken from your baby's arm or hand. The sample will then be sent to a laboratory for analysis. Blood tests are generally less invasive than skin prick tests and may be preferred for very young infants. Elimination diet. If an elimination diet is recommended, you will work closely with a healthcare professional or dietitian to remove specific foods from your baby's diet. They will guide you on how long to eliminate each food and how to reintroduce them for observation. Oral food challenge. If an oral food challenge is conducted, your baby will be given small amounts of a suspected allergen under medical supervision. The healthcare professional will closely monitor your baby for any signs of an allergic reaction. It is important to note that allergy testing should always be performed under the guidance of a healthcare professional. They will interpret the results and provide appropriate recommendations for managing your baby's allergies. 7.2.5 Follow-up after allergy testing. Once the allergy testing is complete, your healthcare professional will review the results with you and discuss the next steps. Depending on the findings, they may recommend specific measures to manage your baby's allergies, such as avoiding certain allergens, implementing dietary changes, or prescribing medications. It is crucial to follow the guidance provided by your healthcare professional and maintain open communication with them regarding your baby's symptoms and any changes in their condition. Regular follow-up appointments may be necessary to monitor your baby's allergies and adjust the management plan as needed. Remember, allergy testing is just one piece of the puzzle in managing your baby's allergies. It is important to work closely with your healthcare professional to develop a comprehensive plan that addresses your baby's specific needs and provides them with the best possible care. 7.3 Interpreting allergy test results in infants. Allergy testing is an important tool in diagnosing allergies in infants. It helps healthcare professionals identify specific allergens that may be causing allergic reactions in babies. Interpreting allergy test results can provide valuable information to parents and caregivers, allowing them to take appropriate measures to manage and prevent allergic reactions in their infants. 7.3.1 Types of allergy tests for infants. There are several types of allergy tests that can be performed on infants to determine the presence of allergens. The most common allergy tests for infants include skin prick test. This test involves placing a small amount of allergen extract on the skin, usually on the back or forearm, and then pricking or scratching the skin to allow the allergen to enter. If the infant is allergic to the specific allergen, a small raised bump, known as a wheal, will appear at the site of the test. Blood test. A blood test, such as the immunocap test, measures the levels of specific antibodies, known as immunoglobulin E (IgE), in the blood. Elevated levels of IgE antibodies indicate an allergic reaction to a particular allergen. Patch test. Patch testing is used to diagnose contact allergies, such as allergic dermatitis. Small amounts of allergens are applied to patches, which are then placed on the baby's back. The patches are left on for a specific period, usually 48 hours, and then removed. If a rash or skin reaction develops at the site of the patch, it indicates an allergic reaction to the specific allergen. 7.3.2 When and how to test for allergies in babies. Allergy testing in infants is typically recommended when there is a strong suspicion of allergies based on the baby's symptoms and medical history. It is important to consult with a healthcare professional, such as a pediatrician or allergist, who can assess the need for allergy testing and guide you through the process. Before conducting allergy tests, it is essential to ensure that the baby is not taking any medications that could interfere with the results. Some antihistamines and certain other medications can affect the accuracy of allergy test results. Your healthcare provider will provide specific instructions on when to stop these medications before the test. Skin prick tests are commonly performed on infants as they are minimally invasive and provide quick results. The test is usually well tolerated by infants, although they may experience mild discomfort during the procedure. Blood tests may be recommended for infants who cannot undergo skin prick tests due to certain medical conditions or if the results of the skin prick test are inconclusive. 7.3.3 Interpreting allergy test results. Interpreting allergy test results in infants requires expertise and knowledge of the specific allergens being tested. The results are typically interpreted by healthcare professionals who specialize in allergies, such as allergists or immunologists. They will consider various factors when interpreting the results, including the size of the wheal or the level of IgE antibodies detected. In the case of skin prick tests, the size of the wheal is measured and compared to a control. A larger wheal indicates a stronger allergic reaction to the specific allergen. However, it is important to note that the size of the wheal does not always correlate with the severity of the allergic reaction. Some infants may have small wheals but still experience significant allergic symptoms, while others may have larger wheals but milder symptoms. For blood tests, the levels of IgE antibodies are measured and compared to established reference ranges. Elevated levels of IgE antibodies to specific allergens indicate an allergic reaction. However, it is important to interpret the results in the context of the baby's symptoms and medical history. A positive test result alone does not necessarily mean that the baby will experience allergic symptoms upon exposure to the allergen. It is crucial to discuss the allergy test results with your healthcare provider to fully understand their implications. They will help you interpret the results and provide guidance on managing and preventing allergic reactions in your infant. They may recommend specific avoidance measures, medications, or allergen immunotherapy based on the test results and the baby's individual needs. Remember that allergy testing is just one piece of the puzzle in diagnosing and managing allergies in infants. It should be used in conjunction with a thorough medical history, physical examination, and evaluation of symptoms to provide a comprehensive understanding of the baby's allergies. Regular follow-up with your healthcare provider is essential to monitor the baby's allergies and adjust the management plan as needed. By interpreting allergy test results accurately, parents and caregivers can take proactive steps to minimize exposure to allergens and provide appropriate care for their allergic infants. 8. Allergy management and treatment for babies. 8.1 Allergy management strategies for parents. Managing allergies in babies can be a challenging task for parents. However, with the right strategies and knowledge, it is possible to effectively manage and minimize allergic reactions in your little one. In this section, we will discuss some practical allergy management strategies that parents can implement to keep their babies safe and healthy. 8.1.1 Create an allergy-friendly home environment. One of the first steps in managing allergies in babies is to create an allergy-friendly home environment. This involves taking measures to reduce exposure to allergens that may trigger allergic reactions. Here are some strategies to consider. Keep the house clean. Regularly clean and vacuum your home to remove dust, pet dander, and other allergens. Use a vacuum cleaner with a HEPA filter to effectively trap allergens. Use allergen-proof bedding. Encase your baby's mattress, pillows, and bedding in allergen-proof covers to prevent dust mites and other allergens from accumulating. Control humidity levels. Maintain optimal humidity levels in your home to prevent the growth of mold and dust mites. Use a dehumidifier in damp areas and ensure proper ventilation. Remove carpets and rugs. Carpets and rugs can harbor allergens, so consider replacing them with hardwood or tile flooring, which is easier to clean. Minimize exposure to pets. If your baby is allergic to pet dander, it may be necessary to keep pets out of certain areas of the house or consider finding them a new home. Avoid smoking indoors. Secondhand smoke can worsen respiratory allergies in babies. Make your home a smoke-free environment to protect your little one. 8.1.2 Identify and avoid allergens. Identifying and avoiding allergens is crucial in managing allergies in babies. Here are some strategies to help you in this process. Keep a diary. Maintain a diary to track your baby's symptoms and potential triggers. This can help you identify patterns and pinpoint specific allergens. Read labels. When purchasing food, skincare products, or household items, carefully read the labels to check for potential allergens. Avoid products that contain ingredients your baby is allergic to. Be cautious with new foods. Introduce new foods to your baby one at a time and observe for any allergic reactions. This can help you identify specific food allergens and avoid them in the future. Be mindful of cross-contamination. If your baby has a food allergy, take precautions to prevent cross-contamination. Use separate utensils, cutting boards, and cooking surfaces for allergenic and non-allergenic foods. Be aware of environmental triggers. Stay informed about environmental triggers such as pollen, mold, and pollution. Check local pollen forecasts and take necessary precautions when outdoor allergen levels are high. 8.1.3 Communicate with healthcare providers. Open and regular communication with your baby's healthcare providers is essential in managing allergies effectively. Here are some tips for effective communication. Share detailed information. Provide your baby's healthcare provider with a comprehensive medical history, including any known allergies, previous allergic reactions, and family history of allergies. Ask questions. Don't hesitate to ask questions about your baby's allergies, treatment options, and any concerns you may have. Understanding your baby's condition will help you make informed decisions. Follow the recommended treatment plan. Work closely with your baby's healthcare provider to develop a personalized treatment plan. Follow the prescribed medications, dosages, and any other recommendations. Seek guidance for emergency situations. Inquire about emergency action plans and know what steps to take in case of a severe allergic reaction. This includes having access to emergency medications such as epinephrine auto-injectors. 8.1.4 Educate family members and caregivers. It is crucial to educate family members, caregivers, and anyone who spends time with your baby about their allergies. Here's how you can ensure their safety. Provide clear instructions. Clearly communicate your baby's allergies, triggers, and necessary precautions to family members and caregivers. Make sure they understand the importance of avoiding allergens. Demonstrate proper medication administration. If your baby requires medication, show family members and caregivers how to administer it correctly. This includes demonstrating the use of epinephrine auto-injectors if necessary. Share emergency contact information. Provide emergency contact information, including your baby's healthcare provider's number and your contact details, to family members and caregivers. Encourage open communication. Encourage family members and caregivers to communicate any concerns or observations regarding your baby's allergies. This will help ensure a safe and supportive environment for your little one. By implementing these allergy management strategies, parents can significantly reduce the risk of allergic reactions in their babies. Remember, each baby's allergies are unique, so it's important to work closely with healthcare providers to develop a personalized management plan. With proper care and attention, you can help your baby live a happy and healthy life, even with allergies. 8.2 Medications for allergic babies. When it comes to managing allergies in babies, medications can play a crucial role in providing relief and reducing symptoms. While it is always important to consult with a healthcare professional before giving any medication to your baby, understanding the different types of medications available can help you make informed decisions about your baby's allergy management. In this section, we will explore the various medications commonly used for allergic babies. 8.2.1 Antihistamines. Antihistamines are a common type of medication used to treat allergies in babies. They work by blocking the effects of histamine, a chemical released by the body during an allergic reaction. Antihistamines can help relieve symptoms such as itching, sneezing, runny nose, and watery eyes. However, it is important to note that not all antihistamines are safe for babies, and you should always consult with a healthcare professional before giving any medication to your little one. For infants, certain antihistamines may be prescribed in liquid form, while others may be available as oral tablets or chewable tablets for older babies. It is crucial to follow the dosage instructions provided by your healthcare professional and never exceed the recommended dose. 8.2.2 Nasal sprays. Nasal sprays can be effective in relieving nasal congestion and reducing inflammation in the nasal passages caused by allergies. They work by delivering medication directly to the affected area, providing targeted relief. Nasal sprays can be particularly helpful for babies who experience symptoms such as a stuffy or runny nose. There are different types of nasal sprays available, including saline sprays, corticosteroid sprays, and antihistamine sprays. Saline sprays are generally safe for babies and can help moisturize and clear the nasal passages. However, corticosteroid and antihistamine sprays should only be used under the guidance of a healthcare professional. 8.2.3 Topical creams and ointments. For babies with skin allergies, topical creams and ointments can provide relief from itching, redness, and inflammation. These medications are applied directly to the affected area and can help soothe the skin. Common topical medications for allergic babies include corticosteroid creams, antihistamine creams, and moisturizers. It is important to use topical medications as directed by your healthcare professional and avoid applying them to broken or irritated skin. Additionally, be cautious about using strong corticosteroid creams on your baby's delicate skin and always consult with a healthcare professional before starting any new medication. 8.2.4 Epinephrine auto-injectors. Epinephrine auto-injectors, commonly known as EpiPens, are emergency medications used to treat severe allergic reactions, such as anaphylaxis. Anaphylaxis is a life-threatening allergic reaction that can cause difficulty breathing, swelling, and a drop in blood pressure. EpiPens deliver a dose of epinephrine, a hormone that helps reverse the symptoms of anaphylaxis and buy time until emergency medical help arrives. If your baby has been diagnosed with a severe allergy, it is important to have an EpiPen on hand at all times. Make sure you and any caregivers are trained on how to use the EpiPen correctly. Remember, EpiPens are only used in emergency situations, and you should seek immediate medical attention after administering epinephrine. 8.2.5 Allergy eye drops. For babies with allergic conjunctivitis, commonly known as pink eye, allergy eye drops can provide relief from itching, redness, and irritation. These eye drops contain antihistamines or mast cell stabilizers, which help reduce the allergic response in the eyes. It is important to consult with a healthcare professional before using any eye drops on your baby, as some may not be suitable for infants. 8.2.6 Probiotics. While not a traditional medication, probiotics have gained attention for their potential role in managing allergies. Probiotics are beneficial bacteria that can help support a healthy gut microbiome. Some studies suggest that certain strains of probiotics may help reduce the risk of developing allergies or alleviate symptoms in allergic individuals. However, more research is needed to fully understand the effectiveness of probiotics in allergy management. If you are considering giving your baby probiotics, it is important to discuss it with your healthcare professional first. They can provide guidance on the appropriate strains and dosage for your baby's specific needs. Remember, medication should always be used under the guidance of a healthcare professional. They can assess your baby's symptoms, diagnose allergies if necessary, and recommend the most appropriate medications for your little one. Additionally, it is important to monitor your baby's response to medication and report any concerns or side effects to your healthcare professional. With proper medication management, you can help alleviate your baby's allergy symptoms and improve their overall well-being. 8.3 Immunotherapy and allergen desensitization in infants. Immunotherapy and allergen desensitization are two treatment approaches that can be used to manage allergies in infants. These treatments aim to reduce the body's allergic response to specific allergens, helping babies build tolerance and alleviate their symptoms over time. While these treatments are more commonly used in older children and adults, recent research has shown promising results in using them for infants as well. 8.3.1 What is immunotherapy? Immunotherapy, also known as allergy shots or allergy injections, is a treatment method that involves exposing the body to small amounts of allergens over a period of time. The goal is to gradually desensitize the immune system to the allergen, reducing the severity of allergic reactions. Immunotherapy is typically administered through injections, but in some cases, sublingual immunotherapy under the tongue drops or tablets may be used. 8.3.2 Immunotherapy for infants. Immunotherapy is generally not recommended for infants under the age of 2 due to their immature immune systems. However, in certain cases, when allergies are severe and unresponsive to other treatments, immunotherapy may be considered for infants as young as 6 months old. The decision to pursue immunotherapy in infants should be made in consultation with a pediatric allergist who can assess the risks and benefits based on the individual baby's condition. 8.3.3 Allergen desensitization in infants. Allergen desensitization is a similar approach to immunotherapy but involves the use of oral immunotherapy (OIT) or sublingual immunotherapy (SLIT) to desensitize the immune system to specific allergens. These methods are particularly useful for infants who may have difficulty receiving injections. Allergen desensitization involves gradually introducing small amounts of the allergen into the baby's diet or under their tongue, allowing their immune system to build tolerance over time. 8.3.4 Benefits and risks of immunotherapy and allergen desensitization in infants. Immunotherapy and allergen desensitization have shown promising results in managing allergies in infants. Some of the potential benefits include reduced allergic symptoms. Immunotherapy and allergen desensitization can help alleviate the severity of allergic reactions, reducing symptoms such as itching, sneezing, wheezing, and skin rashes. Long-term tolerance. By gradually exposing the immune system to the allergen, these treatments aim to build long-term tolerance, potentially reducing the need for ongoing medication and minimizing the risk of severe allergic reactions. Prevention of new allergies. Studies suggest that early allergen exposure through immunotherapy or allergen desensitization may help prevent the development of new allergies in infants. However, it is important to note that these treatments also come with potential risks and considerations, including allergic reactions. While rare, there is a risk of allergic reactions during immunotherapy or allergen desensitization. These reactions can range from mild symptoms to more severe anaphylaxis, requiring immediate medical attention. Time commitment. Immunotherapy and allergen desensitization require a significant time commitment, as they involve regular visits to the allergist for administration and monitoring. This can be challenging for parents of infants who already have busy schedules. Limited evidence in infants. While there is growing evidence supporting the use of immunotherapy and allergen desensitization in older children and adults, research specific to infants is still limited. Therefore, the long-term effectiveness and safety of these treatments in infants are not yet fully understood. 8.3.5 Considering immunotherapy or allergen desensitization for your infant. If you are considering immunotherapy or allergen desensitization for your infant, it is crucial to consult with a pediatric allergist who specializes in treating allergies in infants. They will evaluate your baby's specific allergy profile, medical history, and overall health to determine if these treatments are appropriate and safe. During the consultation, the allergist will discuss the potential benefits and risks of immunotherapy or allergen desensitization, taking into account your baby's age, severity of allergies, and individual circumstances. They will also provide guidance on the treatment process, including the frequency of visits, expected duration, and any necessary precautions. It is important to have realistic expectations and understand that immunotherapy and allergen desensitization may not be suitable or effective for every infant with allergies. The decision to pursue these treatments should be based on a thorough assessment of your baby's condition and a comprehensive discussion with the allergist. Remember, managing allergies in infants requires a multidimensional approach, including allergen avoidance, medication management, and creating an allergy-friendly environment. Immunotherapy and allergen desensitization can be valuable tools in this comprehensive approach, but they should always be used under the guidance and supervision of a qualified healthcare professional. 9. Allergies and breastfeeding. 9.1 The relationship between breastfeeding and allergies. Breastfeeding is not only a beautiful bonding experience between a mother and her baby, but it also provides numerous health benefits for both the mother and the infant. One of the many advantages of breastfeeding is its potential role in reducing the risk of allergies in babies. Research has shown that breastfeeding can have a protective effect against the development of allergies, including food allergies, eczema, and asthma. 9.1.1 The immune system and allergies. To understand the relationship between breastfeeding and allergies, it is important to first understand how the immune system works. The immune system is responsible for defending the body against harmful substances, such as bacteria, viruses, and allergens. In the case of allergies, the immune system mistakenly identifies harmless substances, such as certain foods or environmental triggers, as threats. Breast milk contains a variety of immune-boosting components, including antibodies, white blood cells, and cytokines. These substances help to strengthen the baby's immune system and protect against infections and diseases. Breast milk also contains specific proteins, such as secretory IgA, which can help to prevent the absorption of allergens through the baby's gut. 9.1.2 Early introduction of allergenic foods. Traditionally, it was believed that delaying the introduction of allergenic foods, such as peanuts, eggs, and fish, could help prevent allergies in infants. However, recent research has shown that early introduction of these foods, while the baby is still breastfeeding, may actually reduce the risk of developing allergies. The LEAP Learning Early About Peanut Allergy study, for example, found that introducing peanuts to high-risk infants between 4 and 11 months of age, while continuing to breastfeed, significantly reduced the risk of peanut allergy. This study and others like it have led to a shift in recommendations, with many healthcare professionals now advising parents to introduce allergenic foods early and continue breastfeeding to help reduce the risk of allergies. 9.1.3 Maternal diet and breast milk composition. The composition of breast milk can be influenced by the mother's diet, and certain dietary factors have been associated with a higher risk of allergies in infants. However, the relationship between maternal diet, breast milk composition, and the development of allergies is complex and not fully understood. Some studies suggest that maternal consumption of allergenic foods during breastfeeding may increase the risk of allergies in infants. For example, if a mother consumes cow's milk while breastfeeding, it is possible that small amounts of cow's milk proteins may pass into her breast milk and potentially sensitize the baby to cow's milk allergens. However, more research is needed to fully understand the impact of maternal diet on breast milk composition and its role in the development of allergies. 9.1.4 Exclusive breastfeeding and allergy prevention. Exclusive breastfeeding, where the baby receives only breast milk and no other liquids or solids, is recommended by healthcare professionals for the first 6 months of life. Exclusive breastfeeding provides optimal nutrition for the baby and offers numerous health benefits, including a potential reduction in the risk of allergies. Several studies have found that exclusive breastfeeding for the first 6 months of life is associated with a lower risk of developing allergies, including eczema and asthma. The protective effect of exclusive breastfeeding may be due to the immune-boosting properties of breast milk, as well as the avoidance of potential allergens found in formula or solid foods. 9.1.5 Breastfeeding and allergy management. For babies who have already developed allergies, breastfeeding can still play a role in their management. Breast milk can provide comfort and nutrition for allergic babies, especially if they have food allergies and need to avoid certain allergenic foods. Breast milk is easily digested and can help soothe the baby's digestive system. In some cases, breastfeeding may also help to reduce the severity of allergic reactions. Breast milk contains anti-inflammatory properties that can help alleviate symptoms of allergic conditions, such as eczema or allergic rhinitis. However, it is important to note that breastfeeding alone may not be sufficient to manage severe allergies, and medical intervention may be necessary. 9.1.6 Conclusion. Breastfeeding has numerous benefits for both the mother and the baby, and its potential role in reducing the risk of allergies is an important aspect to consider. While breastfeeding alone may not guarantee allergy prevention, it can contribute to a stronger immune system and provide comfort and nutrition for allergic babies. It is important for mothers to discuss their breastfeeding plans and any concerns about allergies with their healthcare provider to ensure the best possible care for their baby. 9.2 Dietary changes for breastfeeding mothers of allergic babies. Breastfeeding is a beautiful and natural way to nourish your baby, providing them with essential nutrients and antibodies to support their growth and development. For mothers of allergic babies, it is important to understand the impact of your diet on your baby's allergies and make necessary dietary changes to ensure their well-being. 9.2.1 Identifying potential allergens. The first step in making dietary changes for breastfeeding mothers of allergic babies is to identify potential allergens that may be triggering your baby's allergic reactions. Common allergens include cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. However, it is important to note that each baby is unique, and their specific allergens may vary. To identify potential allergens, you can start by keeping a food diary. Write down everything you eat and drink, along with any symptoms your baby experiences after breastfeeding. This will help you track patterns and identify potential triggers. It is also advisable to consult with a healthcare professional or an allergist who can guide you in identifying specific allergens. 9.2.2 Elimination diet. Once you have identified potential allergens, the next step is to eliminate them from your diet. This is known as an elimination diet. It is important to remember that eliminating allergens from your diet should be done under the guidance of a healthcare professional or a registered dietitian to ensure you are still receiving adequate nutrition. During the elimination diet, you will need to avoid consuming any foods or ingredients that contain the identified allergens. This may involve reading food labels carefully and being mindful of hidden sources of allergens. It is also important to note that some allergens, such as cow's milk, may be present in processed foods in various forms, so it is crucial to be vigilant. 9.2.3 Alternative Food Choices. Eliminating allergens from your diet does not mean you have to compromise on nutrition. There are plenty of alternative food choices available that can provide you with the necessary nutrients while avoiding allergens. Here are some examples. Protein sources. If you are avoiding cow's milk, eggs, or soy, you can opt for alternative protein sources such as lean meats, poultry, fish, legumes, and lentils. These foods are rich in protein and can help meet your nutritional needs. Calcium-rich foods. If you are avoiding dairy products, you can still obtain calcium from other sources such as fortified plant-based milk alternatives e.g., almond milk, oat milk, leafy green vegetables e.g., kale, broccoli, and calcium-fortified foods e.g., tofu, orange juice. Omega-3 fatty acids. If you are avoiding fish, you can still obtain omega-3 fatty acids from plant-based sources such as flax seeds, chia seeds, walnuts, and hemp seeds. These foods are rich in essential fatty acids that are important for your baby's brain development. Whole grains. If you are avoiding wheat, you can choose gluten-free grains such as quinoa, rice, millet, and buckwheat. These grains are nutritious and can be incorporated into your meals to provide energy and fiber. Fruits and vegetables. It is important to include a variety of fruits and vegetables in your diet to ensure you are getting a wide range of vitamins, minerals, and antioxidants. These can be consumed fresh, frozen, or in the form of juices and smoothies. 9.2.4 Nutritional Supplements. In some cases, eliminating certain allergens from your diet may result in nutrient deficiencies. To ensure you are meeting your nutritional needs, your healthcare professional may recommend specific supplements. For example, if you are avoiding dairy products, you may need to take a calcium supplement. It is important to follow the guidance of your healthcare professional and take supplements as prescribed. 9.2.5 Reintroducing allergens. Once your baby is older and their immune system has developed further, you may consider reintroducing allergenic foods into your diet. This process, known as food reintroduction, should be done gradually and under the guidance of a healthcare professional or an allergist. They can help monitor your baby's response to the reintroduced foods and guide you on the appropriate timing and method. It is important to note that every baby is different, and what works for one may not work for another. Some babies may outgrow their allergies, while others may have lifelong allergies. It is essential to work closely with your healthcare professional to ensure the best possible care for your allergic baby. Breastfeeding is a wonderful bonding experience between a mother and her baby, and with the right dietary changes, it can continue to be a source of nourishment and comfort for both of you. By identifying potential allergens, following an elimination diet, making alternative food choices, and considering nutritional supplements, you can support your baby's health while breastfeeding. Remember to consult with healthcare professionals for personalized guidance and support throughout this journey. 9.3 Breastfeeding and Allergy Prevention in Infants. Breastfeeding is not only a beautiful bonding experience between a mother and her baby, but it also provides numerous health benefits for both the mother and the infant. When it comes to allergies, breastfeeding plays a crucial role in preventing and reducing the risk of allergies in infants. In this section, we will explore the relationship between breastfeeding and allergy prevention in infants and discuss some important considerations for breastfeeding mothers of allergic babies. The protective role of breast milk. Breast milk is often referred to as liquid gold due to its incredible nutritional and immunological properties. It is specifically designed to meet the unique needs of a growing baby and provides a wide range of essential nutrients, antibodies, and enzymes. These components not only support the baby's overall health and development but also play a significant role in preventing allergies. Breast milk contains immunoglobulin A, IgA, which is an antibody that helps protect the baby's gastrointestinal tract from harmful substances and pathogens. This protective barrier helps prevent the absorption of potential allergens and reduces the risk of allergic reactions. Additionally, breast milk contains other immune factors that help modulate the baby's immune system, promoting a balanced response and reducing the likelihood of developing allergies. Exclusive breastfeeding and allergy prevention. Exclusive breastfeeding, which means feeding the baby only breast milk without any other liquids or solids, is recommended by healthcare professionals for the first 6 months of a baby's life. This period is critical for allergy prevention as it allows the baby's immune system to mature and develop tolerance to potential allergens. Studies have shown that exclusive breastfeeding for the first 6 months of life can significantly reduce the risk of allergies, including food allergies, eczema, and asthma. The protective effects of breastfeeding are believed to be due to the unique composition of breast milk and the transfer of maternal antibodies and immune factors to the baby. Maternal diet and allergy prevention. The maternal diet during breastfeeding can also influence the development of allergies in infants. While breastfeeding mothers do not need to eliminate all potential allergens from their diet, certain dietary modifications may be beneficial for allergic babies. If the baby has already shown signs of allergic reactions or has a family history of allergies, it may be recommended for the mother to avoid common allergenic foods such as cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. However, it is essential to consult with a healthcare professional or a registered dietitian before making any significant dietary changes. Eliminating allergenic foods from the maternal diet can help reduce the exposure of the baby to potential allergens through breast milk. However, it is important to note that this approach may not be necessary or effective for all babies. Each baby is unique, and the decision to modify the maternal diet should be made in consultation with a healthcare professional. Duration of breastfeeding and allergy prevention. The duration of breastfeeding also plays a role in allergy prevention. Studies have shown that the longer a baby is breastfed, the lower the risk of developing allergies. The World Health Organization (WHO) recommends breastfeeding for at least 2 years, with exclusive breastfeeding for the first 6 months. Breastfeeding beyond the first year provides ongoing immune support and helps maintain the baby's tolerance to potential allergens. It is important to remember that breastfeeding is a personal decision, and each mother and baby's circumstances are unique. If breastfeeding is not possible or not continued for an extended period, other strategies can be implemented to reduce the risk of allergies in infants. Introducing solid foods and allergy prevention. When it comes to introducing solid foods to allergic babies, there are some important considerations to keep in mind. The timing and selection of foods can influence the development of allergies. The American Academy of Pediatrics (AAP) recommends introducing solid foods around 6 months of age while continuing to breastfeed. For allergic babies, it is generally recommended to introduce hypoallergenic foods first, such as iron-fortified infant cereals, pureed fruits, and vegetables. These foods are less likely to trigger allergic reactions and can help the baby gradually adapt to solid foods. It is important to introduce new foods one at a time and observe the baby for any signs of allergic reactions. Breastfeeding can continue alongside the introduction of solid foods, providing ongoing immune support and reducing the risk of allergies. Breast milk can also be used to mix with pureed foods, adding extra nutrition and flavor to the baby's meals. Conclusion. Breastfeeding plays a vital role in allergy prevention in infants. The unique composition of breast milk, along with the transfer of maternal antibodies and immune factors, helps protect the baby from potential allergens and supports the development of a healthy immune system. Exclusive breastfeeding for the first 6 months and continued breastfeeding for at least 2 years, along with appropriate dietary modifications if necessary, can significantly reduce the risk of allergies in babies. However, each baby is unique, and it is important to consult with healthcare professionals for personalized guidance on breastfeeding and allergy prevention. 10. Allergies and formula feeding. 10.1 Choosing the right formula for allergic babies. When it comes to feeding babies with allergies, choosing the right formula is crucial. For infants who are unable to tolerate breast milk or have allergies to certain proteins, finding a suitable formula becomes essential for their growth and development. In this section, we will explore the different types of formulas available for allergic babies and provide guidance on selecting the most appropriate option. 10.1.1 Understanding allergies in babies. Before delving into the specifics of formula selection, it is important to have a basic understanding of allergies in babies. Allergies occur when the immune system reacts abnormally to certain substances, known as allergens. In infants, common allergens include cow's milk protein, soy protein, and certain types of carbohydrates. Allergic reactions can manifest in various ways, such as skin rashes, digestive issues, respiratory problems, or even anaphylaxis, a severe and potentially life-threatening reaction. 10.1.2 Types of formulas for allergic babies. When it comes to formula feeding allergic babies, there are several options available. The choice of formula depends on the specific allergen and the severity of the baby's allergy. Here are some of the most common types of formulas for allergic infants. 10.1.2.1 Hypoallergenic formulas. Hypoallergenic formulas are specially designed for babies with allergies. These formulas contain proteins that are extensively hydrolyzed, meaning they are broken down into smaller fragments. This process makes the proteins easier to digest and less likely to trigger an allergic reaction. Hypoallergenic formulas are available in both powdered and ready-to-feed forms. There are 2 main types of hypoallergenic formulas. 10.1.2.1.1 Extensively hydrolyzed formulas. Extensively hydrolyzed formulas (EHF) are the first line of treatment for infants with cow's milk protein allergy or multiple food allergies. These formulas contain proteins that have been broken down into very small fragments, reducing the likelihood of an allergic reaction. EHF is considered safe and effective for most allergic babies. 10.1.2.1.2 Amino acid-based formulas. Amino acid-based formulas AAF, also known as elemental formulas, are the most hypoallergenic option available. These formulas contain individual amino acids, the building blocks of proteins, and are suitable for infants with severe allergies or those who cannot tolerate extensively hydrolyzed formulas. AAF is highly effective in managing allergies but is more expensive than other options. 10.1.2.2 Soy formulas. Soy formulas are made from soy protein and are an alternative for babies who are allergic to cow's milk protein. However, it is important to note that some infants with cow's milk protein allergy may also be allergic to soy protein. Therefore, soy formulas should only be used under the guidance of a healthcare professional. 10.1.2.3 Lactose-free formulas. Lactose-free formulas are designed for babies who have lactose intolerance or difficulty digesting lactose, a natural sugar found in milk. These formulas are not specifically intended for babies with allergies but can be an option for those who have both lactose intolerance and a milk protein allergy. 10.1.3 Selecting the right formula. Choosing the right formula for an allergic baby can be a challenging task. It is crucial to consult with a pediatrician or allergist before making any decisions. They will evaluate the baby's symptoms, conduct appropriate tests if necessary, and provide guidance on the most suitable formula. When selecting a formula, consider the following factors. 10.1.3.1 Allergen avoidance. The primary goal is to choose a formula that avoids the allergen causing the baby's allergic reaction. If the baby has a known allergy to cow's milk protein, an extensively hydrolyzed formula or an amino acid-based formula may be recommended. If the baby is allergic to soy protein, a soy formula may be an option. It is important to read the ingredient labels carefully to ensure the chosen formula does not contain any allergens. 10.1.3.2 Severity of allergy. The severity of the baby's allergy will also influence the choice of formula. Infants with mild to moderate allergies may respond well to extensively hydrolyzed formulas, while those with severe allergies may require amino acid-based formulas. The healthcare professional will assess the baby's symptoms and provide appropriate recommendations. 10.1.3.3 Cost and availability. Consider the cost and availability of the chosen formula. Amino acid-based formulas tend to be more expensive than extensively hydrolyzed formulas or soy formulas. It is important to factor in the long-term cost and ensure the formula is readily available. 10.1.3.4 Taste and acceptance. Babies have different preferences when it comes to taste and acceptance of formulas. Some may readily accept a particular formula, while others may require some adjustment. It may be necessary to try different formulas to find the one that the baby tolerates well and enjoys. 10.1.4 Introducing formula to allergic babies. When introducing formula to allergic babies, it is important to do so gradually and under the guidance of a healthcare professional. Start by offering small amounts of the formula and observe the baby for any signs of allergic reactions. If the baby tolerates the formula well, gradually increase the amount and replace breastfeeding or previous formula feeds. It is crucial to monitor the baby's symptoms and consult with a healthcare professional if any concerns arise. Regular follow-ups with the pediatrician or allergist will ensure that the chosen formula is meeting the baby's nutritional needs and effectively managing their allergies. In conclusion, choosing the right formula for allergic babies requires careful consideration of the baby's specific allergies, the severity of the allergy, and the guidance of a healthcare professional. Hypoallergenic formulas, such as extensively hydrolyzed formulas and amino acid-based formulas, are often recommended for allergic infants. Soy formulas and lactose-free formulas may also be options in certain cases. By selecting the appropriate formula and closely monitoring the baby's response, parents can provide their allergic babies with the nutrition they need while managing their allergies effectively. 10.2 Hypoallergenic formulas for infants with allergies. When it comes to feeding infants with allergies, finding the right formula can be a challenging task for parents. Hypoallergenic formulas are specifically designed to meet the nutritional needs of babies who have allergies or sensitivities to certain ingredients. These formulas are formulated to be easily digested and minimize the risk of allergic reactions. In this section, we will explore the different types of hypoallergenic formulas available and provide guidance on choosing the right one for your allergic baby. 10.2.1 Types of hypoallergenic formulas. There are two main types of hypoallergenic formulas available for infants with allergies: extensively hydrolyzed formulas (EHF) and amino acid-based formulas (AAF). 10.2.1.1 Extensively hydrolyzed formulas (EHF). Extensively hydrolyzed formulas are made from cow's milk proteins that have been broken down into smaller fragments. These formulas are suitable for babies with mild to moderate allergies or sensitivities to cow's milk protein. The hydrolyzation process reduces the allergenicity of the proteins, making them easier for the baby's digestive system to tolerate. EHF formulas are often recommended as a first-line treatment for infants with cow's milk protein allergy, CMPA, or other food allergies. They are available in both powdered and ready-to-feed forms. Some popular brands of extensively hydrolyzed formulas include Nutramigen, Alimentum, and Progestamol. 10.2.1.2 Amino acid-based formulas (AAF). Amino acid-based formulas, also known as elemental formulas, are the most hypoallergenic option available. These formulas are made from individual amino acids, the building blocks of proteins, and do not contain any intact proteins. AAF formulas are suitable for infants with severe allergies or multiple food allergies, as they are highly unlikely to cause an allergic reaction. While amino acid-based formulas are highly effective, they are also more expensive than extensively hydrolyzed formulas. Some commonly used AAF formulas include Neocate, Elicare, and Pure Amino. 10.2.2 Choosing the right hypoallergenic formula. When selecting a hypoallergenic formula for your allergic baby, it is essential to consult with your pediatrician or allergist. They will evaluate your baby's specific allergies and recommend the most appropriate formula based on their needs. Here are some factors to consider when choosing a hypoallergenic formula. 10.2.2.1 Allergen-free. Ensure that the formula you choose is free from the specific allergens that your baby is allergic to. Extensively hydrolyzed formulas are typically free from intact cow's milk proteins, while amino acid-based formulas are free from all common allergens. 10.2.2.2 Age appropriate. Consider the age of your baby when selecting a hypoallergenic formula. Some formulas are specifically designed for newborns, while others are suitable for older infants. It is important to follow the manufacturer's guidelines and your healthcare provider's recommendations regarding the appropriate age for each formula. 10.2.2.3 Taste and texture. Babies can be picky when it comes to taste and texture. Some hypoallergenic formulas may have a different taste or consistency compared to regular formulas. It may take some trial and error to find a formula that your baby accepts and enjoys. Ready-to-feed formulas are often more convenient but can be more expensive than powdered formulas. 10.2.2.4 Cost. Consider the cost of the hypoallergenic formula, especially if your baby will require long-term use. Amino acid-based formulas tend to be more expensive than extensively hydrolyzed formulas. However, some insurance plans may cover the cost of hypoallergenic formulas if they are medically necessary. 10.2.3 Introducing hypoallergenic formula to your baby. Introducing a new formula to your baby's diet should be done gradually to allow their digestive system to adjust. Here are some tips for introducing hypoallergenic formula to your allergic baby. Start by mixing a small amount of the hypoallergenic formula with your baby's current formula or breast milk. Gradually increase the ratio of hypoallergenic formula over several days or weeks. Observe your baby for any signs of allergic reactions or digestive discomfort. Common signs of an allergic reaction include rash, hives, vomiting, diarrhea, or excessive fussiness. If you notice any concerning symptoms, consult your healthcare provider. It may take some time for your baby to adjust to the new formula. Be patient and give them time to adapt to the taste and texture. If your baby refuses the hypoallergenic formula, consult your healthcare provider for further guidance. They may recommend alternative options or strategies to help your baby transition successfully. Remember, every baby is unique, and what works for one may not work for another. It is crucial to work closely with your healthcare provider to ensure that your baby's nutritional needs are met while managing their allergies effectively. In the next section, we will discuss the introduction of solid foods to formula-fed allergic babies and provide guidance on navigating this important milestone. 10.3 Introducing solid foods to formula-fed allergic babies. Introducing solid foods to babies is an exciting milestone in their development. However, for formula-fed babies with allergies, it is important to approach this stage with caution and take certain considerations into account. In this section, we will discuss how to introduce solid foods to formula-fed allergic babies in a safe and manageable way. 10.3.1 Identifying allergenic foods. Before introducing solid foods to your formula-fed allergic baby, it is crucial to identify the specific allergenic foods that trigger their allergic reactions. This information can be obtained through allergy testing or by observing their reactions to certain foods. Common allergenic foods include cow's milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. 10.3.2 Consultation with a healthcare professional. It is highly recommended to consult with your pediatrician or a healthcare professional who specializes in allergies before introducing solid foods to your formula-fed allergic baby. They can provide guidance and support, help you create a personalized feeding plan, and ensure that you are taking the necessary precautions to prevent allergic reactions. 10.3.3 Gradual introduction of solid foods. When introducing solid foods to formula-fed allergic babies, it is best to start with one new food at a time. Begin with a small amount and closely monitor your baby for any signs of an allergic reaction. If there are no adverse reactions, you can gradually increase the amount and variety of foods over time. 10.3.4 Allergen-free foods. For formula-fed allergic babies, it is important to initially introduce allergen-free foods. These are foods that are less likely to cause allergic reactions. Some examples of allergen-free foods include rice cereal, pureed fruits such as apples or pears, and vegetables such as sweet potatoes or carrots. These foods are generally well tolerated and provide essential nutrients for your baby's growth and development. 10.3.5 Allergen introduction. Once your formula-fed allergic baby has successfully tolerated allergen-free foods, you can gradually introduce allergenic foods one at a time. Start with small amounts and closely observe your baby for any signs of an allergic reaction. It is important to wait at least 3 to 5 days before introducing a new allergenic food. This waiting period allows you to monitor your baby's reaction and identify any potential allergies. 10.3.6 Food preparation and cooking methods. When preparing solid foods for your formula-fed allergic baby, it is important to use clean utensils, cutting boards, and cooking surfaces to avoid cross-contamination. Additionally, consider steaming or baking foods instead of frying or sautéing them, as this can help retain their nutritional value while minimizing the risk of allergic reactions. 10.3.7 Allergy emergency plan. As a parent of a formula-fed allergic baby, it is crucial to have an allergy emergency plan in place. This plan should include the steps to take in case of an allergic reaction, such as administering any prescribed medication, seeking immediate medical attention, and contacting emergency services if necessary. Make sure that all caregivers and family members are aware of this plan and know how to respond in case of an emergency. 10.3.8 Monitoring and documentation. Throughout the process of introducing solid foods to your formula-fed allergic baby, it is important to closely monitor their reactions and document any symptoms or changes. This information can be valuable when discussing your baby's progress with your healthcare professional and can help identify any patterns or triggers that may be causing allergic reactions. 10.3.9 Seeking support. Managing allergies in babies can be challenging, both emotionally and practically. It is important to seek support from healthcare professionals, support groups, and other parents who have experience with formula-fed allergic babies. They can provide valuable advice, share their own experiences, and offer emotional support during this journey. 10.3.10 Transitioning to a balanced diet. As your formula-fed allergic baby grows and develops, it is important to gradually transition them to a balanced diet that includes a variety of foods from different food groups. This will help ensure that they receive all the necessary nutrients for their overall health and well-being. Consult with your healthcare professional for guidance on how to achieve a balanced diet for your baby. Introducing solid foods to formula-fed allergic babies requires careful planning, monitoring, and support. By following the guidelines provided by healthcare professionals and taking the necessary precautions, you can help your baby safely navigate this important stage of their development while managing their allergies effectively. Remember, every baby is unique, and what works for one may not work for another. Trust your instincts as a parent and seek professional guidance to ensure the best possible outcomes for your formula-fed allergic baby. 11. Managing allergies in childcare and school. 11.1 Communicating allergies to childcare providers and teachers. When your baby has allergies, it is crucial to effectively communicate their allergies to their childcare providers and teachers. This ensures that your child is kept safe and that everyone involved in their care is aware of their specific needs. By providing clear and concise information about your baby's allergies, you can help create a safe and supportive environment for them. 11.1.1 Importance of communication. Effective communication is key when it comes to managing your baby's allergies in a childcare or school setting. By sharing information about your baby's allergies, you are empowering the caregivers and teachers to take appropriate measures to prevent allergic reactions and provide necessary care if an allergic reaction occurs. It is important to remember that childcare providers and teachers may not have extensive knowledge about allergies or specific allergens. Therefore, it is your responsibility as a parent to educate them about your baby's allergies and provide them with the necessary information to ensure your baby's safety. 11.1.2 Providing detailed allergy information. When communicating your baby's allergies to childcare providers and teachers, it is essential to provide them with detailed information. Here are some key points to consider. Allergen identification. Clearly identify the specific allergens that your baby is allergic to. This includes food allergens, environmental allergens, and any other substances that may trigger an allergic reaction. Allergy symptoms. Describe the symptoms that your baby experiences when exposed to the allergen. This will help caregivers and teachers recognize the signs of an allergic reaction and respond promptly. Severity of allergic reactions. Communicate the severity of your baby's allergic reactions. Let them know if your baby has a mild reaction, such as hives or itching, or if they have a more severe reaction, such as difficulty breathing or anaphylaxis. Emergency contact information. Provide emergency contact information, including your phone number and the contact information of your baby's healthcare provider. This ensures that caregivers and teachers can reach you quickly in case of an emergency. Medications and treatment. Inform caregivers and teachers about any medications your baby may need in case of an allergic reaction. Provide clear instructions on how to administer the medication and any other necessary treatment. Allergy management plan. Work with your baby's healthcare provider to develop an allergy management plan. This plan should outline specific steps to be taken in case of an allergic reaction and provide guidance on preventing exposure to allergens. 11.1.3 Open communication channels. Establishing open communication channels with your baby's childcare providers and teachers is essential for managing their allergies effectively. Here are some tips to facilitate open communication. Schedule a meeting. Arrange a meeting with the childcare provider or teacher to discuss your baby's allergies in detail. This allows you to have a face-to-face conversation and address any concerns or questions they may have. Written documentation. Provide written documentation summarizing your baby's allergies, symptoms, emergency contact information, and any other relevant details. This serves as a reference for caregivers and teachers and ensures that the information is easily accessible. Regular updates. Keep the lines of communication open by providing regular updates on your baby's allergies. Inform caregivers and teachers about any changes in your baby's allergies, new allergens identified, or updates in their allergy management plan. Ask for feedback. Encourage caregivers and teachers to provide feedback on your baby's allergies and their experiences in managing them. This allows you to address any concerns or make necessary adjustments to ensure your baby's safety. Collaboration with healthcare providers. Work closely with your baby's healthcare provider and encourage them to communicate directly with the childcare provider or teacher. This collaboration ensures that everyone is on the same page and that your baby's allergies are effectively managed. 11.1.4 Training and education. It is important to ensure that childcare providers and teachers receive proper training and education on managing allergies in babies. Here are some steps you can take to promote awareness and understanding. Allergy education sessions. Request that the childcare center or school organizes allergy education sessions for staff members. These sessions can be conducted by healthcare professionals or allergy specialists who can provide comprehensive information on allergies, allergen avoidance, and emergency response. Allergy action plan. Work with your baby's healthcare provider to develop an allergy action plan specifically tailored to the childcare or school setting. This plan should outline the steps to be taken in case of an allergic reaction and provide clear instructions for caregivers and teachers. Allergy awareness materials. Provide educational materials, such as brochures or posters, that highlight the importance of allergy management and prevention. These materials can be displayed in common areas to raise awareness among staff members, parents, and other children. Staff training. Ensure that all staff members receive proper training on recognizing the signs of an allergic reaction, administering medication, and implementing allergy management strategies. This training should be conducted regularly to keep staff members updated on best practices. 11.1.5 Collaboration with other parents. Collaborating with other parents whose children have allergies can be beneficial in creating a supportive environment for your baby. Here are some ways to foster collaboration. Parent support groups. Join local parent support groups or online communities where you can connect with other parents of allergic children. These groups provide a platform to share experiences, exchange information, and offer support to one another. Allergy awareness events. Organize or participate in allergy awareness events within your community or at your baby's childcare center or school. These events can help raise awareness about allergies and promote understanding among parents, caregivers, and teachers. Parent-teacher associations. Get involved in parent-teacher associations and advocate for allergy awareness and management. By actively participating in these associations, you can ensure that allergies are given due consideration in school policies and activities. Remember, effective communication and collaboration are essential for managing your baby's allergies in a childcare or school setting. By providing detailed information, establishing open communication channels, promoting training and education, and collaborating with other parents, you can create a safe and supportive environment for your baby. 11.2 Creating an allergy action plan for school. When it comes to managing allergies in childcare and school settings, it is crucial to have a well-defined allergy action plan in place. This plan ensures that everyone involved, including teachers, caregivers, and school staff, is aware of the child's allergies and knows how to respond in case of an allergic reaction. By creating an effective allergy action plan, parents can help provide a safe and supportive environment for their allergic child. 11.2.1 Understanding the importance of an allergy action plan. An allergy action plan is a written document that outlines the specific steps to be taken in case of an allergic reaction. It serves as a guide for teachers, caregivers, and school staff to follow when dealing with an allergic child. The plan should include detailed information about the child's allergies, triggers, symptoms, and emergency contact information. By having an allergy action plan in place, it ensures that everyone is prepared and knows how to respond quickly and appropriately in case of an allergic emergency. 11.2.2 Working with healthcare professionals. Creating an effective allergy action plan starts with consulting healthcare professionals who are familiar with the child's allergies. This may include the child's pediatrician, allergist, or other healthcare providers. These professionals can provide valuable insights and guidance on managing the child's allergies in a school setting. They can help identify potential triggers, recommend appropriate medications, and provide specific instructions on emergency procedures. 11.2.3 Gathering information. To create a comprehensive allergy action plan, it is essential to gather all the necessary information about the child's allergies. This includes identifying the specific allergens that the child is allergic to, understanding the symptoms of an allergic reaction, and knowing the appropriate emergency response. Parents should provide detailed information about the child's medical history, including any previous allergic reactions and the effectiveness of certain medications or treatments. 11.2.4 Communicating with the school. Once all the necessary information has been gathered, it is important to communicate with the school about the child's allergies. Schedule a meeting with the school administration, teachers, and other relevant staff members to discuss the allergy action plan. During this meeting, provide copies of the plan and ensure that everyone understands their roles and responsibilities in managing the child's allergies. It is crucial to emphasize the importance of adhering to the plan and maintaining a safe environment for the allergic child. 11.2.5 Developing the allergy action plan. The allergy action plan should be tailored to the specific needs of the child and should include the following key components. 11.2.5.1 Allergen avoidance. The plan should outline strategies to minimize the child's exposure to allergens. This may include implementing a nut-free or allergen-free classroom, educating staff and students about the child's allergies, and establishing guidelines for food sharing and cross-contamination prevention. 11.2.5.2 Medication administration. If the child requires medication, such as an epinephrine auto-injector, the plan should provide clear instructions on how and when to administer it. It should also specify who is responsible for administering the medication and where it should be stored. 11.2.5.3 Emergency Response. The plan should outline the steps to be taken in case of an allergic reaction. This includes recognizing the signs and symptoms of an allergic reaction, contacting emergency services if necessary, and notifying the child's parents or emergency contacts. 11.2.5.4 Training and Education. The plan should include provisions for training staff members on how to recognize and respond to an allergic reaction. This may involve conducting workshops or providing educational materials on allergies and emergency procedures. 11.2.6 Reviewing and updating the plan. An allergy action plan should be reviewed and updated regularly to ensure its effectiveness. As the child's allergies may change over time, it is important to keep the plan up to date with the latest information. Review the plan with the child's healthcare professionals and make any necessary revisions based on their recommendations. 11.2.7 Sharing the plan with relevant parties. Once the allergy action plan has been finalized, it should be shared with all relevant parties. This includes the child's teachers, school administrators, school nurse, and any other staff members who may be involved in the child's care. It is important to ensure that everyone has a copy of the plan and understands their role in implementing it. 11.2.8 Regular communication and follow-up. Maintaining open lines of communication with the school is crucial in managing allergies effectively. Regularly check in with the school to address any concerns or updates regarding the child's allergies. It is also important to follow up with the child's healthcare professionals to discuss any changes in the child's allergies or treatment plan. By creating an allergy action plan for school, parents can help ensure the safety and well-being of their allergic child. This plan provides a clear framework for managing allergies in a school setting and empowers teachers and staff to respond effectively in case of an allergic reaction. With proper communication, education, and preparation, parents can help create a supportive and allergy-friendly environment for their child at school. 11.3 Educating peers and caregivers about allergies in babies. When it comes to managing allergies in babies, it is not just the parents who need to be educated and informed. Peers and caregivers also play a crucial role in ensuring the safety and well-being of allergic babies. Whether it's a playdate, a family gathering, or a childcare setting, it is important for everyone involved to have a good understanding of allergies and how to prevent allergic reactions. In this section, we will discuss the importance of educating peers and caregivers about allergies in babies and provide some practical tips on how to do so effectively. 11.3.1 Understanding allergies. The first step in educating peers and caregivers about allergies in babies is to help them understand what allergies are and how they can affect infants. Start by explaining that allergies occur when the immune system reacts to certain substances, known as allergens, as if they are harmful. These allergens can be found in various foods, environmental factors, medications, or even skincare products. Allergic reactions can range from mild symptoms like rashes and hives to severe reactions such as difficulty breathing or anaphylaxis. 11.3.2 Common allergens in babies. Next, provide information about the most common allergens in babies. Explain that food allergies are quite common in infants, with some of the top allergens being cow's milk, eggs, peanuts, tree nuts, soy, wheat, and fish. Environmental allergens such as pollen, dust mites, pet dander, and mold can also trigger allergic reactions in babies. It is important to emphasize that each baby is unique, and their specific allergens may vary. 11.3.3 Recognizing allergic reactions. Teach peers and caregivers how to recognize the signs and symptoms of allergic reactions in babies. Explain that these can include skin rashes, itching, swelling, runny nose, sneezing, coughing, wheezing, vomiting, diarrhea, or difficulty breathing. Encourage them to be vigilant and report any unusual symptoms or behaviors to the parents or healthcare provider immediately. 11.3.4 Preventing allergic reactions. One of the most important aspects of educating peers and caregivers is teaching them how to prevent allergic reactions in babies. Start by explaining the concept of allergen avoidance. Encourage them to read food labels carefully, avoid cross-contamination during food preparation, and be mindful of potential allergens in the environment. For example, if a baby is allergic to pet dander, it is important to keep pets away from the baby's living area. 11.3.5 Allergy Action Plan. Introduce the concept of an allergy action plan to peers and caregivers. Explain that an allergy action plan is a written document that outlines the specific steps to be taken in case of an allergic reaction. This plan typically includes information about the baby's specific allergens, symptoms to watch for, emergency contact numbers, and instructions on how to administer any necessary medications, such as epinephrine auto-injectors. Encourage peers and caregivers to familiarize themselves with the baby's allergy action plan and keep a copy readily accessible. 11.3.6 Communication and collaboration. Effective communication and collaboration are key when it comes to managing allergies in babies. Encourage peers and caregivers to have open and honest conversations with the parents about the baby's allergies. This includes discussing any specific dietary restrictions, potential allergens in the environment, and any necessary precautions to be taken. It is important for everyone involved to work together as a team to ensure the baby's safety and well-being. 11.3.7 Training and education. Consider providing training and educational resources to peers and caregivers to enhance their understanding of allergies in babies. This can include sharing informative articles, videos, or attending workshops or seminars on allergy management. The more knowledge they have, the better equipped they will be to provide a safe environment for the allergic baby. 11.3.8 Role Modeling. Encourage peers and caregivers to be good role models when it comes to allergy management. This includes practicing good hygiene, such as washing hands before handling food or the baby, and being mindful of potential allergens when in the baby's presence. By demonstrating responsible behavior, they can help create a safe and supportive environment for the allergic baby. 11.3.9 Empathy and Support. Lastly, emphasize the importance of empathy and support for both the allergic baby and their parents. Allergies can be challenging and stressful for families, and having a supportive network can make a significant difference. Encourage peers and caregivers to be understanding, patient, and compassionate towards the baby and their parents. Small gestures of support, such as offering allergy-friendly snacks or providing a safe space for the baby, can go a long way in creating a positive and inclusive environment. In conclusion, educating peers and caregivers about allergies in babies is essential for the well-being and safety of allergic infants. By helping them understand allergies, recognize allergic reactions, and prevent exposure to allergens, we can create a supportive and inclusive environment for allergic babies. Effective communication, collaboration, and ongoing education are key in ensuring the best possible care for these little ones. 12. Living with allergies. 12.1 Coping with the emotional impact of allergies in babies. Having a baby with allergies can be a challenging and emotional experience for parents. It is natural to feel overwhelmed, worried, and even guilty when your little one is suffering from allergic reactions. Coping with the emotional impact of allergies in babies is an important aspect of managing their condition and providing them with the support they need. In this section, we will explore some strategies to help parents navigate the emotional journey of raising an allergic baby. Understanding and accepting the diagnosis. The first step in coping with the emotional impact of allergies in babies is to understand and accept the diagnosis. It is common for parents to experience a range of emotions, including sadness, frustration, and even anger, upon learning that their baby has allergies. It is important to remember that allergies are not anyone's fault and that they can occur in any child. Educating yourself about allergies, their causes, and treatment options can help you feel more empowered and better equipped to manage your baby's condition. Seek support. One of the most valuable resources for parents of allergic babies is support from others who have gone through similar experiences. Connecting with other parents who have children with allergies can provide a sense of community and understanding. Online forums, support groups, and social media platforms can be excellent sources of support and information. Sharing your concerns, fears, and triumphs with others who can relate can help alleviate some of the emotional burden. Additionally, seeking support from family and friends is crucial. Letting your loved ones know about your baby's allergies and how it affects your daily life can help them understand and provide the necessary support. Having a strong support system can make a significant difference in managing the emotional impact of allergies. Educate yourself and others. Knowledge is power when it comes to managing allergies in babies. Educating yourself about your baby's specific allergies, their triggers, and how to prevent and manage allergic reactions can help you feel more in control. Understanding the signs and symptoms of an allergic reaction and knowing how to respond can also alleviate anxiety and fear. Furthermore, educating others about your baby's allergies is essential. This includes family members, friends, caregivers, and even teachers or childcare providers. Providing them with accurate information about your baby's allergies, including what to avoid and how to respond in case of an allergic reaction, can help create a safe and supportive environment for your little one. Practice self-care. Caring for an allergic baby can be physically and emotionally draining. It is crucial for parents to prioritize self-care to maintain their own well-being. Taking time for yourself, whether it's engaging in a hobby, practicing mindfulness or relaxation techniques, or seeking professional help if needed, is essential. Remember that you cannot pour from an empty cup, and taking care of yourself allows you to better care for your baby. Focus on the positive. While allergies can be challenging, it is important to focus on the positive aspects of your baby's life. Celebrate their milestones, achievements, and unique qualities. Surround yourself with positive experiences and create a nurturing environment that fosters your baby's growth and development. By focusing on the positive, you can help shift your mindset and reduce the emotional impact of allergies. Communicate openly. Open and honest communication is key when it comes to managing the emotional impact of allergies in babies. Talk to your partner, family members, and friends about your feelings and concerns. Share your experiences and ask for support when needed. Additionally, communicate openly with your healthcare provider about any emotional struggles you may be facing. They can provide guidance, resources, and even refer you to a mental health professional if necessary. Celebrate small victories. Managing allergies in babies is a journey filled with ups and downs. Celebrate the small victories along the way. Whether it's successfully avoiding a trigger, finding a safe and delicious food option, or witnessing your baby's resilience, acknowledging and celebrating these achievements can boost your morale and provide a sense of accomplishment. Seek professional help if needed. If you find that the emotional impact of allergies in your baby is overwhelming and affecting your daily life, do not hesitate to seek professional help. A mental health professional, such as a therapist or counselor, can provide guidance, support, and coping strategies tailored to your specific situation. Remember, seeking help is a sign of strength, and it can greatly benefit both you and your baby. In conclusion, coping with the emotional impact of allergies in babies is a journey that requires understanding, support, and self-care. By educating yourself, seeking support, practicing self-care, and focusing on the positive, you can navigate the challenges of raising an allergic baby with resilience and strength. Remember, you are not alone, and with the right tools and mindset, you can provide your baby with the love, care, and support they need to thrive despite their allergies. 12.2 Supporting allergic babies in social settings. Having a baby with allergies can present unique challenges when it comes to social settings. As a parent, it is important to ensure that your allergic baby feels supported and included in various social situations. This chapter will provide guidance on how to navigate social settings while keeping your baby safe and comfortable. 12.2.1 Educating others. One of the first steps in supporting your allergic baby in social settings is to educate others about their allergies. This includes family members, friends, caregivers, and even other parents. By providing information about your baby's allergies, you can help others understand the importance of avoiding certain allergens and taking necessary precautions. When educating others, it is essential to be clear and concise about your baby's allergies. Explain the specific allergens that your baby is allergic to and the potential reactions they may experience. Emphasize the importance of avoiding cross-contamination and the need for strict avoidance of allergens. 12.2.2 Communicating with caregivers. If your allergic baby attends daycare or has a caregiver, open and ongoing communication is crucial. Provide detailed information about your baby's allergies, including a list of allergens to avoid and any specific instructions for managing allergic reactions. Make sure the caregiver understands how to administer any necessary medications, such as antihistamines or epinephrine auto-injectors. Regularly check in with the caregiver to ensure they are following the necessary precautions and protocols. It is also important to keep them updated on any changes in your baby's allergies or treatment plan. By maintaining open lines of communication, you can work together to create a safe and supportive environment for your allergic baby. 12.2.3 Playdates and social gatherings. Participating in playdates and social gatherings can be a source of anxiety for parents of allergic babies. However, with proper planning and communication, these events can still be enjoyable for everyone involved. When attending playdates or social gatherings, inform the host about your baby's allergies in advance. Discuss any necessary accommodations, such as avoiding certain foods or ensuring a pet-free environment. Offer to bring safe snacks or meals for your baby to ensure they have suitable options. During the event, closely monitor your baby for any signs of an allergic reaction. Be prepared to administer any necessary medications and have an emergency action plan in place. It may also be helpful to bring your own allergen-free toys or activities to ensure your baby can participate fully. 12.2.4 School and extracurricular activities. As your allergic baby grows older, they may start attending school or participating in extracurricular activities. It is essential to work closely with the school or activity organizers to create an allergy management plan. Meet with the school staff or activity leaders to discuss your baby's allergies and any necessary accommodations. Provide them with written instructions on how to handle allergic reactions and administer medications. Ensure that all staff members are trained in recognizing and responding to allergic emergencies. In addition to educating the school or activity staff, it is important to teach your allergic baby how to advocate for themselves. Teach them how to read food labels, recognize potential allergens, and communicate their allergies to others. Encourage them to speak up if they feel unsafe or if they suspect they have come into contact with an allergen. 12.2.5 Building a support network. Support from other parents who have allergic babies can be invaluable. Consider joining local support groups or online communities where you can connect with other parents facing similar challenges. These groups can provide a safe space to share experiences, exchange tips, and offer emotional support. Additionally, involve family members and close friends in your baby's allergy management. Educate them about your baby's allergies and encourage them to learn how to administer medications if necessary. Having a strong support network can help alleviate some of the stress and anxiety associated with managing allergies in social settings. 12.2.6 Promoting inclusivity and understanding. Supporting allergic babies in social settings goes beyond just managing their allergies. It is also important to promote inclusivity and understanding among peers and caregivers. Encourage open conversations about allergies, emphasizing the importance of empathy and respect. Teach children and caregivers about the potential severity of allergic reactions and the importance of avoiding allergens. Foster an environment where allergic babies feel comfortable and supported, free from judgment or exclusion. By promoting inclusivity and understanding, you can help create a safer and more supportive social environment for your allergic baby. Conclusion. Supporting allergic babies in social settings requires proactive communication, education, and planning. By educating others, communicating with caregivers, and promoting inclusivity, you can help create a safe and supportive environment for your baby. Remember to stay vigilant, be prepared for allergic reactions, and build a strong support network to navigate the challenges of living with allergies. 12.3 Building resilience in allergic infants and toddlers. Living with allergies can be challenging for both parents and their allergic infants and toddlers. Allergies can affect various aspects of a child's life, including their emotional well-being and social interactions. However, with the right strategies and support, it is possible to build resilience in allergic infants and toddlers, helping them navigate the world with confidence and strength. 12.3.1 Understanding resilience in allergic infants and toddlers. Resilience refers to the ability to adapt and bounce back from challenges and setbacks. For allergic infants and toddlers, building resilience involves developing coping mechanisms, managing emotions, and fostering a positive mindset. It is important to remember that resilience is not something innate, it can be nurtured and developed over time. 12.3.2 Educating and empowering allergic infants and toddlers. One of the first steps in building resilience in allergic infants and toddlers is to educate them about their allergies in an age-appropriate manner. As they grow older, they can begin to understand the concept of allergies and how they can manage them. By providing them with information about their allergies, you empower them to take an active role in their own health and well-being. 12.3.3 Encouraging open communication. Open communication is crucial in helping allergic infants and toddlers build resilience. Encourage them to express their feelings and concerns about their allergies. Create a safe and non-judgmental space where they can freely talk about their experiences, fears, and frustrations. By listening attentively and validating their emotions, you can help them develop a sense of self-confidence and self-advocacy. 12.3.4 Teaching problem-solving skills. Allergic infants and toddlers may face unique challenges in their daily lives, such as avoiding allergens, managing allergic reactions, or dealing with social situations. Teaching them problem-solving skills can empower them to find solutions and overcome these challenges. Encourage them to brainstorm ideas, evaluate different options, and make decisions that prioritize their health and safety. 12.3.5 Building a supportive network. Having a strong support network is essential for allergic infants and toddlers. Surround them with understanding and supportive family members, friends, and caregivers who can provide encouragement and assistance when needed. Connect with other parents of allergic children through support groups or online communities to share experiences, advice, and resources. By building a supportive network, you create a sense of belonging and reduce feelings of isolation. 12.3.6 Promoting self-care and healthy habits. Self-care plays a vital role in building resilience in allergic infants and toddlers. Teach them the importance of taking care of their bodies and minds. Encourage healthy habits such as eating a balanced diet, getting regular exercise, and practicing good hygiene. Help them understand the significance of following their allergy management plan, taking medications as prescribed, and attending regular checkups with healthcare professionals. 12.3.7 Encouraging age-appropriate independence. As allergic infants and toddlers grow, it is important to gradually encourage age-appropriate independence. Allow them to take on tasks related to their allergies, such as reading food labels, packing their allergy-friendly snacks, or communicating their allergies to others. By giving them opportunities to be independent, you foster their self-confidence and resilience. 12.3.8 Promoting positive self-image. Living with allergies can sometimes make allergic infants and toddlers feel different from their peers. It is crucial to promote a positive self-image and help them embrace their uniqueness. Encourage them to focus on their strengths, talents, and achievements rather than solely on their allergies. Teach them that having allergies does not define their worth or limit their potential. 12.3.9 Seeking professional support. If you notice that your allergic infant or toddler is struggling with their allergies or their emotional well-being, do not hesitate to seek professional support. Allergists, pediatricians, or child psychologists can provide guidance and assistance in managing allergies and building resilience. They can offer strategies tailored to your child's specific needs and help them develop effective coping mechanisms. 12.3.10 Celebrating successes. Lastly, celebrate the successes, no matter how small, with your allergic infant or toddler. Recognize their efforts in managing their allergies and overcoming challenges. By acknowledging their achievements, you reinforce their resilience and motivate them to continue their journey with confidence.